Hello everyone. So welcome to All India Mock Test GPAT Mock Test paper discussion, and I hope you enjoyed the exam. So since 6 a.m., so many students are attempting the exam, and still some people are attempting. So all the best for your exam and write well. We are going to start the live discussion. So if you are in the middle, please join the live discussion. Okay, this is very important, and we will start with the pharmacology questions first. So as you know, so many changes has been happened in the GPAT examination. Okay, so section wise distribution, time distribution, questions distribution is happened. So you please make sure that you are following the rules and regulations of GPAT exam. So let us start with the discussion. So we'll go to the first question. So the question is given based on sodium chromoglycate. Okay, so the correct mode mechanism of action of sodium chromoglycate. So what is the So correct mechanism action of sodium chromoglycate. So option A, anticholinergic. Option B, mast cell stabilization. Option C, none of the above. Option D, antihistamine. So students, I am telling, if you are perfect with the pharmacology classification, you will get very good score in pharmacology. Only classification. So many questions they give on pharmacology classification. So please thorough with pharmacology classification. These 5 to 6 days you must concentrate on the classification. So please, anyone can answer the question. What you have opted in your examination, mock exam? So what is the correct answer? Direct question. So based upon the classification, right? So whether sodium chromoglycate is anticholinergic drug or antihistaminic drug or mast cell stabilization. Okay, so yes, so many people answered this question. So coming to the answer, so this is a mast cell stabilizer. Okay, sodium chromoglycate is a mast cell stabilizer, so which stabilize the mast cell membrane, preventing the degranulation and inhibiting the release of histamine. Right. So here we'll see the mast cell stabilization, how the mast cell will be stabilized. Here we'll see the structure of mast cell. So in inactivated condition, it will be intact. Okay, but when it is activated, when it will be activated, then the activated mast cell will be degranulated. Okay, degranulated. So this our drug sodium chromoglycate is going to stabilize the mast cell, right? So stabilize the mast cell chromoglycate, then it will block the degranulation. So once it is activated, it will go to the degranulation, but this sodium chromoglycate blocks the degranulation. So further it will stabilize and the allergic response. Okay, whatever the allergic response is there, that will be reduced. So this is the mechanism of the sodium chromoglycate. Next question. So choose the drug belonging to the complex action opioids, that is partial mu agonist and kappa antagonist. So this is very important question. Okay, if you remember the classification properly, you can answer easily. On opioids, you will get one question on every examination, every GPAT examination. You will get pakka one question, right? So this is very important. Okay, so the first option is buprenorphine, nalorphine, and pentajocin. All of this just classification. If you remember classification in depth, you can able to answer these kind of questions, right? So complex action of opioid, partial agonist and kappa antagonist. What is the drug which act as a partial agonist of mu receptors and antagonist of kappa receptors? Yes, anyone answer? I want your participation. So if you interact, if you involve in the discussion, and that will be added value for your final preparation. Okay. So here, if you see the different receptors, okay, opioid receptors act on the two different. Yes, very good. Okay. So here we'll see the two types of receptors, mu receptors and kappa receptors. Here I've given the list of drugs where it will act as an agonist and where they act as an antagonist, right? So this is the classification of opioid receptors. If you see pure opioid agonist, the examples morphine, codeine, and meperidine and other morphine-like drugs act as an agonist on mu receptors. Okay, so they act as an agonist on mu receptors, and whereas the kappa receptors also they act as an agonist. So you remember, so pure drugs act both receptors they act as an agonist, right? And coming to the agonist antagonist opioids. So here pentazocine, nalbuphine, butorphanol, and buprenorphine. So these are different here. So these drugs in mu receptors they work as an antagonist, and whereas in the case of kappa receptor they work as an agonist. So opposite actions, right? And then here the other drug like buprenorphine important, partial agonist in case of mu receptors and antagonist in kappa receptors. Classification is very, very important. Don't get confused. This is the clear differentiation between the agonist and antagonist of opioid receptors, right? Especially pure opioid antagonist, naloxone. So very, very important. So many times in the GPAT examination, this question is repeated. Okay, naloxone, right? So naloxone, opioid antagonist, naloxone, right, and naltrexone. And in the case of both mu and kappa receptor, this works as an antagonist. Opioid receptor antagonist. So many times they repeated in the examination. So antagonist, naloxone. So remember this one. Very, very, very important. Naloxone and buprenorphine and morphine. So these three drugs you have to remember, right? Three drugs are very, very important, and please concentrate. Okay. Yes. Move to the next question. Yeah, this is another. So another way of representation. So just to remember very easily. So morphine. So these are the three important drugs. That's what I'm telling. Three important drugs you remember. Always question comes on these three drugs. Okay. Morphine on mu receptors full agonist, and again mu receptors this buprenorphine mu receptor partial agonist, and naloxone antagonist. Remember naloxone, based upon naloxone they repeated so many times in the examination. Remember this. Okay. Yes. Next question. Buspirone. Okay, so the question based upon buspirone. So azaspirin decandione. So the direct chemical IUPAC name given in 2017 examination GPAT. So this is a very, very important drug. Okay, azaspirin decandione. Direct they asked the chemical name, IUPAC name in previous examinations. Here we have given in a different format. So buspirone. Identify the correct statement. Buspirone does not produce significant sedation or cognitive impairment. First statement. And second statement, buspirone as muscle relaxant and anticonvulsant activity. Buspirone interacts with the benzodiazepine receptors and GABAergic receptors. And last statement, buspirone is rapidly absorbed, undergoes extensive first pass metabolism, half-life 2 to 3.5 hours. Please answer your question. So options 1 true, 2 4 false, 1 2 true, 3 4 false, 1 4 true, 2 3 false. Okay, 1 3 true, 4 false. So these type of questions are going to come in your final GPAT examination. These kind of questions you can answer if you are concept oriented only. Otherwise you will get negative marks. Can anyone answer this question? If you are feeling very deep question, so you just leave it. Okay, in pharmacology also some of the questions we can leave. Even topper will not answer all the questions of pharmacology, but you try. Okay, if you prepare well, if you are able to guess, you can try always. Anyone, please. At least in the discussion you can participate. Buspirone. What is the category of buspirone? Okay, so we'll go to the answer. So the C is the right answer. Okay, C is the right answer. First statement and fourth statement, very good. First statement and fourth statements are true, and the third, second are false. Here we'll see. So this is a true statement. Buspirone lacks significant sedative properties. It do not show the sedation effect. and then rapidly absorbed but undergoes extensive first pass metabolism. The half-life is 2 to 3.5 hours. These are the true statements. And coming to the false statements, it does not have muscle relaxant and anticonvulsant activity, and it does not interact with the BZD or GABA receptors. It is a 5-HT1A partial agonist. Okay, it will not react with other receptors like BZD and GABA. It is the drug which acts on the 5-HT, okay, 5-hydroxytryptamine 1A partial agonist drug. No more relation to the GBD or BZD, GABA or BZD receptors. Next question, antibiotics from chemotherapy. So Griseofulvin is indicated in Griseofulvin is indicated in, right, all types of tinea infections and pityriasis varicoso and then onchocerciasis, both A and C. Yes. Yes, somebody answered, right? Priyanka Gaud. Okay. Some others. I want everyone to involve in the discussion. It will help your preparation. So if it is right, if your option is right in the discussion, you will get confidence. If it is wrong, and you will remember because it is wrong. Okay, so we'll go to the answer. So all types of tinea infections. Okay, this Griseofulvin indicated in all types of tinea infections because it is an antifungal antibiotic. Okay, because it is an antifungal antibiotic specifically indicated in dermatophytosis, tinea infection. See here, this is the tinea infection. Okay, skin infection and fungal infections, right? So it deposits in keratin containing tissues like skin and hair and nails. Okay, so this is Griseofulvin antifungal antibiotic. Antifungal antibiotic, right answer. Both are right answer. Okay, next question. Identify the endothelin receptor antagonist used in the treatment of pulmonary hypertension. Pulmonary hypertension lo use chese drug enti, which is a endothelin receptor antagonist. Direct classification. Okay, based upon the classification only. First drug, sildenafil. Second drug, Bosentan. Third drug, ipoprostenol. And fourth drug, diazoxide. Answer please. Endothelin receptor antagonist for pulmonary hypertension. So, మన discussion నుంచి direct questions వస్తాయి GPAT లో. So, please concentrate. Okay, very good. So many people answered right. Okay, so Bosentan is the right answer. Very good. So Bosentan is an oral endothelin receptor antagonist, blocks ETA and ETB receptor. Endothelin receptor A and receptor B, they block both receptors, and it is a vasoconstrictor. Okay, so remember, it is a potent vasoconstrictor because it is inhibiting endothelin receptors. Okay, endothelin receptor. Here we can see the mechanism. So here the endothelin release will happen and endothelin binds to ETA and ETB receptors. Okay, then it further leads to vasoconstriction. Okay, receptor activation causes constriction. Then, okay, so then Bosentan will inhibit these kind of actions. So it leads to vasodilation and relief. Vasodilation and relief. So this will help in the pulmonary arteries dilation and PHA pressure falls. So this will help in the pulmonary hypertension, right? So Bosentan, okay, Bosentan used in pulmonary hypertension. Remember. Okay, next question. Okay, so one of the following is used in the treatment of hyperprolactinemia. Hyperprolactinemia use చేసే డ్రగ్ ఏంటి? Cimetidine, bromocriptine, methotrexate, ondansetron. Yes. Hyperprolactinemia లో యూజ్ చేసే డ్రగ్స్ ఏంటి? కొన్నిసార్లు మనకి క్వశ్చన్స్ ఎక్కడి నుంచైనా రావచ్చు, రైట్? Yes, cimetidine, bromocriptine, methotrexate, ondansetron. Very good, very good. Okay, so చాలా మంది చాలా బాగా ప్రిపేర్ అయ్యారు. So the right answer is bromocriptine. Okay, so bromocriptine is a dopamine 2 receptor agonist. Okay, so this will inhibit the prolactin release from the anterior pituitary. So prolactin released from the anterior pituitary. మీకు pituitary gland లో 2 types ఉంటాయి, 2 parts ఉంటాయి, anterior pituitary, posterior pituitary. ఏ ఎక్కడ నుంచి ఏ హార్మోన్స్ వస్తాయి అనేది కూడా గుర్తుపెట్టుకోవాలి. మీకు anatomy and physiology కూడా very important. In the case of anatomy and physiology, so these type of statements are very, very important. So this will be released from the anterior pituitary, stimulating the D2 receptor, reduce the prolactin secretion, right? And this drug, especially bromocriptine, is a drug of choice. The drug of choice for treating hyperprolactinemia. So this is the drug of choice for hyperprolactinemia and prolactinomers. Notably, cimetidine can actually increase the prolactin levels. Cimetidine levels opposite ఉంటాయి bromocriptine కి. Bromocriptine కి cimetidine కి opposite action ఉంటుంది. Okay, so please concentrate. Okay, next question. Antiemetic neuroleptic agent. Indicate an antiemetic agent belonging to the class of neuroleptic. So always remember, if you are reading one class of drugs, so remember if this class is belonging in any other class. Suppose anti-cancer drugs you are reading, okay, and you are also reading some of the other class drugs like alopecia. Okay, so involved in alopecia, right? So what are the drugs prescribed in anti-cancer treatment which helps in alopecia? Can anyone? This belongs to other class of drug. Yes, can anyone answer? Drugs prescribed in chemotherapy, okay, anti-cancer supplement. What is a drug used as a supplement in chemotherapy to prevent alopecia? This is also GPAT question. Can anyone? It is minoxidil. Okay, minoxidil. So minoxidil, the side effect of minoxidil is more growth. Okay, hair growth will be very high. So this will be given in the cancer because alopecia is the side effect of anti-cancer drugs. Okay, like that you remember intercategory drugs. So here first one is metoclopramide and nabilone and tropisetron and prochlorperazine. So what is the drug? Yes, so many answered. So that is right answer. Prochlorperazine. Prochlorperazine is a phenothiazine derivative. Phenothiazine derivative classified as a neuroleptic, means antipsychotic drug that possesses potent antiemetic properties via D2 receptor blocking. Okay, D2 receptor block చేయడం వల్ల this possesses potent antiemetic properties, right? So here the other drugs are metoclopramide is a prokinetic agent like domperidone. Okay, so these are prokinetic agents, and nabilone is a cannabinoid. There is no more relation to the particular question. And tropisetron is also 5-3 antagonist, and chlorperazine is the right answer. So it's a neuroleptic drug, and also it will block the D2 receptor. It will also block the D2 receptors. This is very, very important. Next question. Lincosamides have the unwanted effect of nephrotoxicity, carcinogenicity, pseudomembranous colitis, and irritation of respiratory organs. Lincosamides. Yes, lincosamides. Unwanted effect. So in pharmacology, mechanism, classification, side effect, use. If you remember this, you can easily score very good marks. Yes, the right answer is pseudomembranous colitis. So lincosamides, example clindamycin. Okay, clindamycin. So clindamycin is the drug strongly associated with the pseudomembranous colitis caused by the overgrowth of Clostridium difficile. This is an important causative agent for pseudomembranous colitis, right, in gut flora. Okay, this is caused in gut flora. This is the serious adverse effect of particular infection of this causative agent, that is Clostridioides and difficile, right? So this is normal flora, and when it acts, the clindamycin is given, so that will be difficile overgrowth and pseudomembranous colitis. So this will cause pseudomembranous colitis. Yellowish plaques on the colon, large intestine wall are the hallmarks of endoscopic findings. So when this particular drug given, so this will happen. Okay, so in endoscopy we will get to see these kind of changes. Next question, anti-helminthic drug that acts by increasing chloride conductance. Anti-helminthic drug that acts by increasing chloride conductance. Niclosamide, ivermectin, levimazole, mebendazole. Mechanism of action. Mechanism of action గుర్తుపెట్టుకుంటే ఆన్సర్ చేయొచ్చు ఈజీగా. రైట్, ఆన్సర్ ప్లీజ్. వెరీ గుడ్. మిగతా వాళ్ళందరూ ఆన్సర్ చేయాలి. ఎవ్రీబడి షుడ్ ఆన్సర్, ఇన్వాల్వ్ ఇన్ ద పేపర్ డిస్కషన్. You can type just the ABCD. No need to write full name. Okay. So the right answer is ivermectin. Okay. Ivermectin binds to glutamate gated chloride channels. Okay. So this will binds to this glutamate gated chloride channels, and then it will cause increase in the chlorine conductance. This is the mechanism of ivermectin. Very, very important drug. Okay. Chala important. So many times they asked in the examination. And based on this ivermectin drug, okay, increase the chloride conductance, which will further cause to hyperpolarization of the cell, and which leads to parasitic cell death. Okay, which leads to parasitic cell death. Sir, will all in rank of this test will come? I didn't get your question. Can you repeat? Who is this? Yeah, please repeat your question. Okay, so you can type in the chat box. Drug of choice. Yeah, all India rank. Yes, we will give you the results. Okay, at the end of the paper discussion, we will announce all the results. Okay, and top 10 members also will tell your score and in detail names also. Okay, all India rank will give you, and in app will upload your individual ranks as well. Okay, in the app will upload your individual ranks also. Don't worry. Okay, good. So drug of choice for acute adrenal insufficiency. Dexamethasone, prednisolone, hydrocortisone, betamethasone. Answer please. What is your answer? Drug of choice. Yes, very good. Drug of choice, acute adrenal insufficiency. Very good. Right answer, hydrocortisone. Okay, hydrocortisone is also called as cortisol. Very good. All of you right answer. Okay, hydrocortisone also called as cortisol is the drug of choice for acute adrenal insufficiency. That is called Addisonian crisis. And this helps to restore blood pressure and correct electrolyte imbalance immediately. Right? Synthetic drugs like dexamethasone lack sufficient mineralocorticoid activity. Right? Here you have to remember, here is important thing, hydrocortisone's dual action on sodium water retention. Okay? Hydrocortisone's dual action on sodium water retention and glucose metabolism makes it uniquely suited for adrenal crisis. This is the most commonly used drug in the treatment, hydrocortisone, steroids. Okay, in the primary stage of all the required treatment, they'll prescribe this hydrocortisone. It's also called as cortisol. Okay, released by adrenal cortex. Okay, next coming to the chemotherapy. So match the anti-TB drugs and then mechanism and the drugs. So rifampicin, bedaquiline, ethambutol, pass, para-aminosalicylic acid. Yes, if you remember, if you are able to answer one mechanism, then you will easily get the other mechanisms also. Okay, yes, match the drug. Rifampicin, what is the mechanism action of rifampicin? Can anyone? 1, 2, 3, 4. Rifampicin mechanism of action. You can type number 1, 2, 3, 4. Oh, very good. Okay, so rifampicin means 2A. Okay, so there will be options. Okay, you can easily answer these kind of questions, right? Here 2A, if you find out one, if you are able to find out one option, then easily you can answer these kind of questions. So 1C, right? So ethambutol mechanism of action, so inhibits the arabinosyl transferase and cell wall synthesis inhibition. And then rifampicin already it inhibits the DNA dependent RNA polymerase. Very, very important. Rifampicin, you will get one question in final GPAT examination. Rifampicin is always a target drug in competitive examinations, right? And then PAS, okay, para-aminosalicylate, important. It inhibits the folate synthesis. Okay, folate synthesis, it will further inhibit the folic acid synthesis, folate antagonist. Okay, folate synthesis. And bedaquiline inhibits the mycobacterial ATP synthase. Okay, bedaquiline inhibits the mitochondrial mycobacterial ATP synthase. Okay, mycobacterial ATP synthase enzyme. Mechanism of action, direct question. Okay, next question. The drug causing direct depression of myocardial contractility by reducing intracellular calcium concentration. Option A, halothane. B, desflurane. C, enflurane. D, sevoflurane. Yes, answer please. Very good. All of you. Gandhari will answer. Everyone should answer in this live discussion. Okay, because it will help your final preparation. Okay. Okay, the right answer is enflurane. So among volatile anesthetics, enflurane is noted for causing significant direct depression of myocardial contractility. It reduces the influx of calcium ions into cardiac muscle cells, thereby decreasing the force of contraction. Okay, this makes it less favorable in patients with compromised cardiac function. So enflurane is the right answer. This is the mechanism, right? Okay, next chemotherapy question. So identify the statement that best describes the malaria parasite life cycle. So from anti-malarial drugs also you will get one question pakka. Okay, based on the classification, right? So malaria, anti-malarial. Right. Identify the statement that describes malaria parasite life cycle. What is the first stage? Okay, it is the question based on the different stages. Okay, if you remember the life cycle, you will be able to answer. Otherwise, it is very, very difficult. Okay, gametocyte, blood cygens, erythrocytic stage, merozoites, exoerythrocytic stage, and next blood cygens, erythrocytic stage, exoerythrocytic stage, merozoites, and gametocytes. And then exoerythrocytic stage, merozoites, erythrocytic stage, blood cygens, and gametocytes. The last option is erythrocytic stage, merozoite, exoerythrocytic stage, and blood cygens. Please answer. Correct stages of malaria parasite. Okay, I don't want to waste your time. So this is the life cycle of malaria parasite, that is Plasmodium. So there are two life cycles are there. So one is in the host, that is human. The second one is in the mosquito. Even mosquitoes will get malaria fever. Okay, mosquitoes will also get malaria fever. Well, when this Plasmodium infects mosquitoes, right? So here there are different stages. So please concentrate on the stages. The number one, sporozoites. Okay, in the sporozoite form, they enter into the human blood by biting the infected mosquito. Infected mosquito bites to human, so the sporozoite form will enter into the human body here. Okay, so the sporozoites will enter into the human body. Then there they will convert it into different stages. Okay, from sporozoites to they will form merozoites. Okay, from sporozoites to change the color. Okay. Good. So from sporozoites to they will be converted into merozoites. Okay, so from the merozoites again they will be converted into different stages. This is cygens. Okay, so ring form. Okay, so ring form, and they will also infect a human liver cell. Okay, human liver cell, and they will be converted into gametocytes. Okay, then the different stages: gametes, then zygotes, then ookinete, then oocyst. So these are the different stages of the malaria. There will be 15 different stages. Okay, so this parasite converts into 15 different stages, right? And we are targeting at various stages of this malaria parasite. Remember the malaria life cycle. Yes, this is the right answer. See, first one is exoerythrocytic stage, and then merozoites. Okay, then erythrocytic stage, and then blood cygant, then gametocytes. So gametocyte will form in the mosquito, right? Right. So if you remember the proper order, then you will be able to answer. Otherwise, it will become very difficult. The cycle begins in the liver. That is exoerythrocytic stage. In the human, the cycle begins in liver. That stage is exoerythrocytic stage, is the first stage. Then merozoites. Okay. Then erythrocytic stage. Once it infects the blood, there it will convert into ring form, cygant form, blood cygants, rosette structure. So all these structures will form inside the RBC. Okay. Once they multiply inside the RBC, and they will burst. Okay. They burst the RBC cells. When the RBC will be bursting, we will get the fever, chill fever. Okay. చలి జ్వరం వస్తుంది అంటారు కదా, ఎందుకంటే ఆ బ్లడ్ సెల్లో మల్టిప్లై అవుతుంది ప్లాస్మోడియం. మల్టిప్లై సెల్ బ్లడ్ సెల్ అనేది బర్స్ట్ అవుతుంది. ఆ బర్స్టింగ్ అయినప్పుడు మనకు చలి జ్వరం వస్తుంది, రైట్? సో దట్ ఈస్ ఫ్రీక్వెంట్ ఫీవర్ వస్తూ ఉంటుంది మనకి. సో ఫస్ట్ స్టేజ్ ఇస్ exoerythrocytic stage, right? So then gametocytes taken up by the mosquito. So when the infected patient, okay, when the infected patient the mosquito bites the infected patient, the gametocyte stage will taken up by the mosquitoes. Okay, so gametocytes start in the mosquito cycle and they release the merozoites into host. Just remember 4 stages. Okay, gametes enter into the mosquito, sporozoites enter into the human. 2 stages. The life cycle starts in the host is exoerythrocytic stage, right? So these 3 stages at least you remember, starting and ending stages. Okay, this is different way of representation of malaria life cycle. So here there are different stages. You see the mosquito takes a blood meal of infected patient. Okay, the gametes, they enter into the liver cell, right? This is the human stage, and the infected liver cell release cygants. Okay, then they rupture the cygants and they infect the RBC. In the RBC it will form trophozoites. Okay, then mature trophozoite, then cygant. Okay, then ruptured cygant. So here sometimes what will happen? So these gametes, okay, these gametes taken up by the mosquito and they will enter into the mosquito life cycle. Okay, so mosquito life cycle, gametes will enter inside the mosquito. Okay, then they form into different stages, eukaryote, oocyst. Okay, and then sporozoites. These sporozoites again they enter into the mosquito. So in this way 2 life cycles are there. Please concentrate on the malaria parasite life cycle. Next question, identify the correct statement. Mefalon is very less effective in multiple myeloma. Second statement, nitrosoureas class blood-brain barrier. Third statement, ifosfamide produces greater neurotoxicity and hemorrhagic cystitis. And last statement, cyclophosphamide is more damaging to platelets. Alopecia and cystis are prominent. Yes. Answer please. Anti-neoplastic alkylating agents, true or false? Yes, answer. Okay, good. C, right. So Q, R are true and PS are false, right? So here the true statements, both nitrosoureas are lipophilic drugs, okay, and cross the BBB, blood-brain barrier, okay, useful in brain tumors. The other statement which is true is ifosfamide cause significant neurotoxicity and hemorrhagic cystitis. If you remember the drug name and side effect, you can easily answer these kind of questions, right? Next, melphalan actually highly effective in multiple myeloma, okay, but here in the statement it is given wrong, right? The other wrong statement is about platelet damage, misleading. Cyclophosphamide causes cystitis via acrolein metabolite, but Q and R distinctly correct fact. Okay, so like this, if you remember the drug name and side effect, you can easily answer these kind of statement based questions. Next, therapeutic index is a measure of, simple direct question, therapeutic index. If you know the definition, you will answer. Potency, safety, selectivity, efficacy. Therapeutic index. Somebody saying safety and somebody answering as efficacy. This is what the final competitive exam will be. Okay, don't get confused. Therapeutic index. Okay, everybody should answer. The right answer is safety. Okay, so therapeutic index is the ratio of the toxic dose to the therapeutic dose. Toxic dose to the therapeutic dose. TD50 by ED50. Okay, TD50 by ED50. It quantifies the safety of drug. And a higher TI, therapeutic index, indicates a wider margin between the effective dose and the toxic dose. Here the formula is therapeutic index formula. LD50 by ED50, lethal dose and effective dose. LD50 by ED50. Okay, a higher value is safer drug. Okay, a narrow therapeutic index means require careful monitoring. Therapeutic monitoring. Okay, therapeutic drug monitoring. Yes, very good, very good. Okay, don't get confused this kind of questions. So this is here in the diagram. It is clearly depicts ED50 and TD50. Okay, therapeutic window. This is called therapeutic window. In the clinical trials, this is very important stage where whether the FDA should approve or not. Based upon this only, they decide. Right. So adjuvant hematinic among the following: thiamine, ascorbic acid, niacin, pyridoxine. Yes. Adjuvant hematinic, the following: thiamine, ascorbic acid, niacin, pyridoxine. All of you. Okay, the right answer is pyridoxine. Okay, pyridoxine. Why? According to the provided key, pyridoxine, it is also called as vitamin B6. So the list of vitamins you have to remember, and the numbering of the vitamins and the diseases. Okay, B6. Okay, pyridoxine. So it is also called as B6, identified as the adjuvant hematinic. It is essential for the heme synthesis as a cofactor for ALA synthesis. Okay, it is involved in the heme synthesis. Very important. The rate limiting enzyme in the heme biosynthetic pathway, used as a therapeutic agent in sideroblastic anemia. It is also used in sideroblastic anemia. Okay, so mainly it involves in the ALA synthase. ALA synthase, which helps in heme synthesis, hemoglobin synthesis. Okay, heme synthesis lo involve avutadi. That's why it is used as a correct answer, right? Okay, here I have given different vitamins. So very important. Every time you will get one question from this table. Okay, thiamine is a B1. Okay, so the coenzyme here is thiamine pyrophosphate, TPP, and the groups transferred is aldehyde, right? And then riboflavin. So here the coenzymes here is FMN and FAD, right? And then here the transfer of group is hydrogen and electron. Okay, next B3 niacin. This is mainly pellagra. Okay, so pellagra associated diseases, and the cofactor coenzyme is NAD and NADP. Important, you will get in biochemistry also. Okay, biochemistry point of view, and the medicinal chemistry point of view, pharmacology. You remember these kind of points, right? NAD and NADP and hydrogen electron transfer. Pantothenic acid coenzyme A. Pyridoxine, pyridoxal phosphate. Biotin, same biotin. Folic acid, tetrahydrofolate. Okay, tetrahydrofolate, right? And then cobalamin B12, methylcobalamin. Okay, cofactors, coenzymes, right? Very important. Okay, so again, other way of representation of different vitamins. So what are the different diseases associated with the vitamins? Vitamin A, okay? So vitamin A, reduced night vision, and vitamin B6, anemia, cracks at the corner of the mouth. So cracks at the corner of the mouth generally occurs in your body, okay? So remember, this is because of vitamin B6, pyridoxine, and vitamin C, swollen and bleeding gums, okay? And then poor wound healing and easily bruising. This is because of vitamin C. That's why vitamin C always supplemented in some kind of patients. Then vitamin B1, thiamine, okay, beriberi disease. B1, beriberi, okay, memory loss. I think all of you facing these symptoms during the examination. Please take vitamin B1 supplements. Vitamin B complex you take. It will improve your memory. B1, okay, thiamine. And then also for paralysis, confusion, and rapid heart rate. And vitamin B7, biotin, right? And then vitamin D, you know already, osteomalacia and bone pain, muscle pain, weakness. And then vitamin B2, riboflavin, okay, B2, riboflavin. And here sore throat. The main deficiency because of B2 is sore throat. Yeah, sore throat, and then inflamed tongue and decrease in red blood cell count. Okay. And then vitamin B9, folate, fatigue, weakness, and shortness of breath. And vitamin B3, I already said, niacin, pellagra, okay, vomiting, diarrhea, headache, and memory loss, dermatitis. And then vitamin B5, pantothenic acid. Then vitamin B12, cobalamins, fatigue, weakness, infertility, dementia, and numbness. Okay, these are the deficiencies of vitamin B12. And vitamin K, impaired blood clotting. Impaired blood clotting, vitamin K. Okay, so these are the diseases associated with the vitamin A, vitamin D, and BC. Very, very important. One question expected from this table, from this slide. Okay, next question. Desmopressin exerts its action by. Desmopressin exerts its action by. Mechanism of action question. Stimulating the release of factor 8, increasing the thirst and fluid intake, directly inhibiting ADH release, blocking V1 vasopressin receptors. Yes, answer please. Right, very good. Okay, the right answer is A, stimulating the release of factor 8. Desmopressin is a synthetic analog of vasopressin. Desmopressin is a synthetic analog of vasopressin. It acts on V2 receptors on endothelial cells, stimulates the release of stored factor 8. Okay, and also VWF factor, von Willebrand factor from Weber platelet bodies. It is used in mild hemophilia. Important. It is used in hemophilia. Okay, hemophilia disease. So this is the clotting cascades. Right. This is intrinsic pathway. And remember, what are the factors involved in intrinsic and extrinsic differentiation? You must remember. Okay. So intrinsic pathway. So factor 12 and factor 11, factor 9 and 8. So these will involve in the intrinsic. Okay, and in the extrinsic manaki factor 3 and factor 7. This will involve in the extrinsic pathway, right? And finally, formation of a fibrin, which leads to clotting. Okay, so remember, intrinsic lo involve ayevi manaki main ga 12, 11, 9 and 8. 8, 9, 11, 12, 4. And the extrinsic lo manaki just 3 and 7. Okay, 3 and 7. Remember this one, very important. Okay, next. Synthetic corticosteroid commonly used in asthma. Synthetic corticosteroid commonly used in asthma. Yes, can anyone answer? Synthetic corticosteroid commonly used in asthma. Okay. So options are prednisolone, and triamcinolone, fluticasone, and clobetasol. So oral, systemic, various routes, and inhaled and topical skin. Synthetic corticosteroid. Okay, very good. So the right answer is fluticasone. Okay, fluticasone is a potent synthetic corticosteroid formulated for inhalation. Inhalated corticosteroid. Okay, inhalated corticosteroid. The example is, so this is an inhaler. Okay, mostly asthma people use these kind of medical devices, inhalers. You must know, right? So what are the other drugs? Prednisone is a oral and systemic use, right? Clobetasol, topical for skin conditions. Fluticasone, inhaled and target for bronchial inflammation directly. So just remember the category of the drug and you will answer these kind of questions. So the other examples are given here, all the drugs used in bronchial asthma. So leukotriene antagonists, Montelukast, Jafarlikast, Montelukast తీసుకుంటారు general గా when you get fever and cough and cold, general people write this Montelukast and levocetirizine combination, right? So this Montelukast is a leukotriene receptor antagonist, right? And then mast cell stabilizer already we discussed in the first question, that is sodium chromoglycate. Okay, then corticosteroids, systemic is hydrocortisone, already we discussed in prednisolone and other glucocorticoids. And inhalation, we use beclomethasone, okay, dipropionone, budesonide, they all are inhalation. All we use in the we use with inhalers. You already know that. Okay, then anti-IgE antibody omalizumab. Okay, only one drug, omalizumab. Please remember the classification. If you remember the classification, you will answer many questions. And coming to the bronchodilators, so bronchodilators, beta-2 sympathomimetics and methylxanthine. Beta-2 sympathomimetics, salbutamol, terbutaline, danbuterol, solmetrol, and formoterol, right? And methylxanthines, theophylline and aminophylline. Okay, theophylline and aminophylline, choline, and hydroxyethyltheophylline, doxyphylline. And anticholinergics used in the bronchial asthma, ipratropium bromide and tiotropium bromide. These two drugs used in anticholinergic drugs used in asthma. Okay, then next question, anti-secretory diarrheal agent among the following. Anti-secretory diarrheal agent among the following: amoxicillin, ciprofloxacin, mesalazine, atropine. Yes, answer please. Andar answer cheyali. Everybody should answer. The right answer is mesalazine. Okay, so mesalazine primarily used in inflammatory bowel disease. Okay, inflammatory bowel disease also called as Crohn's disease. Okay, and in this context, it's identified as an agent with anti-secretory or anti-inflammatory effects in the gut, lining the reduced diarrheal symptoms associated with the inflammation here. So these are the gut lining. Okay, so this is associated with the gut lining. If gut lining is disturbed, then so many further symptoms will appear. Okay, gut is very, very important. If you are happy, then your gut, if your gut is happy, you will become happy, because gut will synthesize the serotonin. Okay, ante manchi food తీసుకుంటే మంచిగా ఉంటాం. So food also affects our happiness. Okay, so that's why gut is very, very important. Yes, then reasoning question. So in terms of chemotherapy, class 2 reactions are better targets. Then the reason is human cells lack the ability possessed by bacteria to synthesize essential amino acids as well as certain growth factors. So the options are both A and R are true, but R does not explain A. A is false, but R is true. Both A and R are true, and R explains A. A is true, but R is false. Yes, can anyone? ఎవరైనా ఆన్సర్ చేసిరా ఈ క్వశ్చన్ని? వదిలేసిరు అందరు? Did you left in the negative or thinking? Okay, don't worry. If you are feeling difficulty, just leave the question. Okay, don't but try at least. Okay, if you remember, if you are able to, if you have a concept and in one statement also, you will be able to answer these kind of questions. Okay, the right answer is C. Okay, both A and R are true, but R explains A. Okay, so here the assertion is class 2 reactions, that is synthesis of essential metabolites like folate and amino acids, are good drug targets because human acquire these from diet, because it is absent in the human, like folic acid, right? And the reason, bacteria must synthesize essential amino acids and growth factors de novo, and whereas human cells lack these pathways. Okay, both are true. So that's why the C is the right answer. Next question, activation of which G protein coupled receptor results in the production of secondary messengers IP3-DAG? Secondary messengers IP3-DAG. Which receptors? So there are different types of receptors: GQ, GI, GB, GS. Yes, G protein coupled receptor. G protein coupled receptors. You will be expecting these kind of questions in the final examination. Okay, please understand the concept. Right, so many are answering A, some people are answering D. Okay, let us go to the right answer. So that is A, GQ receptor. Okay, GQ protein coupled receptor pathway activates PLC, phospholipase C, and which cleaves PIP2 into inositol triphosphate, IP3, and DAG, diacyl glycerol. Okay, this is involved in GQ receptor. Okay, IP3 releases calcium from intracellular stores and DAG activates the protein kinase. Right, so this will further activates the adenyl cyclase, increase the GMP and inhibits the adenyl cyclase. So we will see the different kind of secondary messengers involved in the G protein. So here the neurotransmitter norepinephrine, okay, noradrenaline will bind when it will bind to the G protein coupled receptor. Okay, so it will activate the adenyl cyclase, and then it will further activate the cyclic AMP. Then it will further activate the protein kinase A, increase the protein phosphorylation. Right, here glutamate, if the glutamate binds to this particular GPCR, then it will be acting on the phospholipase C, which will further divide it into DAG and IP3. Okay, so this IP3 release the calcium and DAG act on the protein kinase. Right, so these are the secondary messages involved in the GQ. Okay, alpha and beta. Then coming to the other kind of G protein coupled receptors, that is dopamine. In case of dopamine, it will bind to GI, and then it will activate adenyl cyclase, increase the cyclic AMP, and then protein kinase, then increase the protein phosphorylation. Okay, so these are GPCR effector pathways and different types of secondary messengers involved in the G protein coupled receptor. Drugs of antibiotic class that function by altering permeability of the cell membrane. Cell membrane permeability interrupted by which kind of drugs? Glycopeptides, okay, glycopeptides, polymyxins, tetracyclines, cephalosporins. Yes, tetracyclines we can eliminate because they inhibit the protein synthesis by binding to 30S ribosomes. Okay, then cephalosporins, they are different. They act on the they are the beta-lactam antibiotics. Okay, they act on the cell wall. Okay, coming to the glycopeptide and polymyxin. Yes, very good. Okay, so many answered correctly. The right answer is polymyxins. Okay, so polymyxins, example colistin. Example drug is colistin, act like a cationic detergent. They interact with the lipopolysaccharides and phospholipids in the outer membrane of gram-negative bacteria, altering membrane. Remember, these will act on the gram-negative, not gram-positive. Okay, gram-positive will be having the cell wall, and the cell membrane is gram-negative always. Yeah, this kind of. Okay, these are the different classes of antibiotics. Just I want to revise all the antibiotics. Aminoglycosides inhibit the protein synthesis by acting on the 30S ribosomes. Okay, cephalosporins inhibit the cell wall synthesis. Okay, tetracyclines inhibit the protein synthesis, 30S ribosomes. Okay, penicillins same inhibit the cell wall synthesis by binding the peptidoglycan synthesis, inhibiting the peptidoglycan synthesis. And sulfonamides inhibit the folate synthesis, okay, folate synthesis inhibition, FO. And then fluoroquinolones, inhibit the DNA replication and quintuplets. Okay, then macrolides inhibit the protein synthesis by binding the 50S ribosomes. Okay, appa. Okay, fine. And then carbapinums inhibit the cell wall synthesis, lincosamides inhibit the protein synthesis, and glycopeptides inhibit the cell wall synthesis. Okay, and here remember malt. If you remember malt, these all drugs inhibit the protein synthesis, macrolides, aminoglycosides, lincosamides, tetracyclines. Malt, okay, malt inhibits the protein synthesis. Okay, next, a patient with partial seizures is started on AED with minimal hepatic metabolism, negligible enzyme induction, and minimal drug interactions. The drug binds to synaptic vesicle protein SV2A. Identify the drug. So this is the question given on mechanism of action. Okay. So lamotrigine, carbamazepine, levetiracetam, phentoin. Patient with partial seizures started with AED with minimal hepatic metabolism and negligible enzyme induction. So remember, you note down all the drugs which are enzyme inducers and enzyme inhibitors. If you list down all these drugs, you will answer very easily. No need to be confused seeing the statement 3 to 4 lines paragraph, and don't worry all those things. Just whether it is an enzyme inducer or inhibitor, just concentrate there. Yes, answer please. Yes, very good. So many people answer correct one. Okay, levetiracetam. Levetiracetam is a unique among AEDs. Okay, it binds to SV2A protein synaptic vesicles. It is not significantly metabolized by the hepatic C450 enzymes. Okay, has negligible enzyme induction, right, and has very few drug-drug interactions, making it safer. The unique target is SV2A synaptic vesicle, minimum hepatic metabolism, and is safe for polytherapy. Levetiracetam. So these are the different drugs used in seizures. Example, the brand name also are given, but not important. Just you can note down for the reference purpose, right? So lorazepam. Okay, lorazepam side effects and dizziness, drowsiness, and valproate, sodium valproate, upset of stomach, and then acetazolamide, appetite loss and frequent urination. Okay, appetite loss and frequent urination. These are the common side effects of the antipsychotic drugs. Then match the following: isoniazid, rifampicin, and pyrazinamide, ethambutol. Remember, if you get these kind of questions, already I said rifampicin. If you know about whole story of one drug, you can answer many questions. That is mechanism, and this is side effect. Simple pharmacology. You can score very good if you know the mechanism and side effect. Right? Answer. Okay. The right answer is A, A1, B2, C3, D4. Isoniazid, peripheral neuropathy, important. Causes vitamin B6 deficiency. Peripheral neuropathy is a main side effect of isoniazid. Rifampicin or red. Okay, so it is orange but red color urine. Okay, so orange discoloration and harmless but alarming body fluid color change. So red color fluids will become red or orange color. And then pyrazinamide, hyperuricemia, inhibits the urate excretion and it causes gout. Okay, and then ethambutol, color blindness. Ethambutol, color blindness, also optic neuritis and red green color blindness. Ethambutol. So these are the classification of anti-TB drugs. Just for the revision purpose, I have kept here. Right. If you remember right, these are the first line drugs. Right means rifampicin, isoniazid, pyrazinamide, ethambutol. RIPE is a first line treatment for anti-TB drugs. Okay, and then supplement drugs: rifabutin, rifapentin, streptomycin. And second line drugs: chloroquinolones, amikacin, capreomycin, ethionamide, and pars cycloserine. So first line, second line. If you remember the classification, you will be scoring very good in pharmacology. Okay, next, identify the agent acting as an antidote for paracetamol. Very simple question, direct question. So many times they ask in the examination. Antidote of paracetamol. Naloxone is a morphine, opioid, atropine is different, protamine is different, and here it is very simple question, that is N-acetylcysteine. Very good. Okay, N-acetylcysteine is the right answer. Paracetamol overdose leads to accumulation of the toxic metabolite, that is NAPQI, which depletes the glutathione and causes liver necrosis. It will cause liver damage. Okay, that is N-acetylcysteine act as a precursor to glutathione, replenishing the stores and detoxifying. It is a specific antidote administered early. Overdose of, yes. So please, from the pharmacology, first mechanism you must remember. Okay, then match the drug adverse effects. Okay, if you able to remember the drugs and side effect, will be easily answering the questions, right? And here we'll see high associations like isoniazid, neuropathy, ethambutol, color blindness, Okay, and clindamycin also. Okay, ethambutol and clindamycin. Then pseudomembranous colitis and some other important areas where classification. I am always pressurizing on the classification. If you are able to recollect the classification, you will get a good score, right? And antidotes, right? Antidotes also very, very important. Okay, next some of the questions we'll discuss from the microbiology and biotechnology. So, which microorganism involved in the assay of rifampicin? Direct, simple, straightforward question from this area. They will ask drug and assay microorganism. So many antibiotics also having these kind of assay microorganisms that I'll tell you. So, rifampicin, assay of rifampicin, Bacillus subtilis, Micrococcus luteus, Bacillus cumulus, Bacillus cereus. Answer please. Very good. Right answer. Okay. Subtilis. Okay. Official test organism is Bacillus subtilis, recommended by Pharmacopoeia, IP, BP, USP. Right. So many important, so many exams they will give these kind of questions. Right. And rifampicin, Bacillus subtilis. And you already know the mechanism of rifampicin. It inhibits the bacterial DNA dependent RNA polymerase. Okay. And then there are different drugs and their test organism. Okay, here amikacin, Staphylococcus aureus, right? So this is ATCC number means so American tissue culture cell type number. It is stored in this number in the bank, cell culture bank. And here you remember the drugs names and their assay microorganism, test microorganism. Very, very important. One question expected from this slide. One question in this GPAT 2026. We are expecting one question from this slide. Note it down and remember the drug name and organism name. Drug name and assay organism name. Okay, next question. The intervening nucleotide sequences in mRNA which do not code for protein. So, yes, options are poly-A tail, spliceosome, introns, and none of this. If you know the DNA structure, DNA composition, or DNA parts, then easily you will answer this kind of questions. Yes, non-coding sequence. Answer please. Very good. Yes, that is introns. So DNA lo rendu untai, introns untai, exons untai. Introns are non-coding, exons for coding. Okay, exons for coding. Coding nunchi manaki mRNA form avutadi, RNA nunchi protein vastadi. Okay, so this is the structure of DNA. Okay, base pairs untai, T ki A pair aitadi, two bonds untai, G ki C pair aitadi, triple bond untadi. So itla manaki DNA structure untadi, crystal structure. This is the crystal structure of DNA, right? And sugar backbone untadi. Em sugar untadi, deoxyribose sugar untadi, phosphate backbone untadi, nucleotides ఉంటాయి. Okay, right? So this is the structure of DNA. ATGs అంటే మీకు ఆల్రెడీ తెలుసు, right? And what about others? Poly A tail. Okay, poly A tail ఎక్కడ యాడ్ అవుతుంది? ఆఫ్టర్ ట్రాన్స్క్రిప్షన్ తర్వాత మనకి యాడ్ అవుతుంది. ఇప్పుడు పోస్ట్ ట్రాన్స్క్రిప్షనల్లీ ఫర్ mRNA stability and nuclear export. There is nothing related to the coding. Poly A tail. And spliceosome is nothing but the ribonucleoprotein complex that catalyzes the intron removal, not a sequence itself. Okay, intron removal. So spliceosome, splicing ante cutting. Okay, so this is how you have to remember. Introns are non-coding sequences. Okay, next question. Okay, RNA polymerase. Which of the following subunit of RNA polymerase is solely required for the initiation of transcription? Initiation of transcription. Very, very important question. Initiation of transcription. Which factor is initiated in the transcription? Okay, involved in the transcription. Alpha, omega, beta, sigma. Yes, answer please. Answer. Direct question in many examinations. Okay, initiation factor ante okate gurtupeట్టుకోవాలి, sigma is the initiation factor, right? So sigma is the initiation factor. It is a dissociable subunit of bacterial RNA polymerase essential for the transcription initiation. It involved in the transcription initiation, right? Alpha involved in the assembly and promoter of element interaction, up element interaction, and beta involved in the catalytic center for RNA synthesis, and omega involved in the stabilizers assembly, not directly involved in the initiation. Okay, first sigma, dan tarvata alpha, beta, omega ivi involve avutayi. Just remember. Okay, right. Next, these are the main differences between the DNA and RNA. Basic differences, right? So RNA lo manaku thymidine is replaced by uracil. Remember this, okay? So ATGC here uracil. Okay, uracil is replaced by thymidine. This is uracil. This is uracil is replaced by thymidine. And sugar backbone renditiki untadi ribonucleic acid, deoxyribonucleic acid. Just the difference of small difference in the chemical, otherwise both are same, right? And nuclear bases difference and base pairing also same, and only difference is thymidine is replaced by uracil. So purines, pyrimidines, adenine, guanine, purine, cytosine, thymidine, pyrimidine. Okay, so just remember the base pairs, about history of base pairs, right? Okay, so DNA polymerase. So how it will replicate, involved in the replication, right? So this is double stranded DNA. Okay, it will cleaved by the helicase, DNA helicase enzyme. So this will become two single strand, and these two single strands, DNA polymerase will add nucleotides to the single strand, and it will become double. Okay, so this will add nucleotides to the single strand, it will become double stranded, and this is called leading strand. Important, leading strand. So where DNA polymerase add the nucleotides to the leading strand, and the other strand, there is again different types of DNA polymerase. They will add Okazaki fragments. Okazaki fragments added to lagging strand. There are two strands, we name it, that is leading and lagging. So lagging and leading. Lagging is DNA polymerase. Okay, directly they will add new nucleotides to the single strand. Leading strand, DNA polymerase will lead. It will become leader for this strand, and the other fragment is lagging. So it is a lazy. Okay, lagging. That's why the frames will be added directly. That is called, the frames name is Okazaki fragments. Okazaki fragments, leading and lagging. So the question came in GPAT examination: which one is leading and which one is lagging? Okay. So and they asked in the examination Okazaki fragments. Okazaki fragment added in which type of stand? Leading stand or lagging stand, like that. Okay. So Okazaki fragments always added to the lagging stand. Okay. Next question: the media containing complex organic substances such as blood, serum, hemoglobin, and special growth factors called. Here they are asking about media, not your non-veg mutton curry, right? So culture media. What is the component of culture media? Blood, serum, hemoglobin, and special growth factors called. Okay. Synthetic media, differential media, enriched media, selective media. Answer please. Very good. Okay. So that is called enriched media. So there are different types of medium. So in enriched medium, it contains blood, serum, egg yolk, and growth factors to support the fastidious organisms that cannot grow on minimal media. Okay, examples include blood agar. So here write down the examples. So that includes blood agar medium, chocolate agar medium. Okay, Loeffler serum slope. So these are the enriched medium example, right? And then synthetic means chemically precise composition, no complex additives. And selective media means inhibit unwanted microbes, especially McConkey agar. Okay, McConkey agar is very, very important. So many times they asked it in the examination. And differential medium differentiate microbes by visible changes, lactose fermentation and McConkey. And I have given some of the other information about medias also. Here, it's a general culture medium, blood agar medium looks like this. Okay. Then enriched medium, chocolate agar medium, and this is McConkey agar medium, and this is selective medium. Just to remember the. Okay, so here this is covered pharmacology and microbiology and biotechnology questions. Okay, so we'll continue with the pharmaceutics questions and medicinal chemistry questions and all other questions. Stay tuned. Okay, so now we'll start with the medicinal chemistry questions. Okay, so now, yes, are you ready? Are tired? Okay, we'll start with the medicinal chemistry questions. Okay, we'll continue.
So hello everyone, good evening. Now we'll start with the pharmaceutical chemistry, okay? So, once again, are you people ready? Yes. So how was the exam? I think exam was pretty good because the question paper was almost moderate and easy, mix of easy and moderate questions, right? We will start with the pharmaceutical chemistry. In this, we will complete the organic chemistry, medicinal chemistry, and I think biochemistry will also be there. Along with that, analysis question will also be there. Okay, so we'll complete that, and you have to be active because we will complete that pretty fast. Okay, now. So the first question is albendazole. So the question, albendazole, an antiemetic drug, has one group at 5 position in the benzimidazole structure. It is C3H7CO, C2H5CO, C6H5S, and C3H7S. So what is the answer? I think. So what is the answer? First of all, can you please tell me the structure of benzimidazole? What is present in benzimidazole? The core structure of benzimidazole. See the structure of albendazole. In this, you will see one benzene ring connected with diazole. So that is called benzdiazole. Okay. Now in that, you will see along with that one another nitrogen group. This group is called guanidine group. This is the guanidine functional group. Okay. Along with this guanidine group, again you will see along with that guanidine group, again you will see one carboxyl group present. C double bond. So when this nitrogen is connected with this carboxyl group, this is called amide group. Okay. So in this amide group, again you will see one ether group is present. That is called methoxy group. Okay. But the question that is asked not from this side. The question is asked from the other side. In the other side of benzene, you will see one sulfur connected with 1, 2, 3, like this. Okay. So what is that? C3S, right? So what are the option? See what are the option? C3H7CO, C3H7CO, C6H5S, and C3H7S. So what is the answer? The answer is C3H7S, right? So what is this group called? What is this group called? This group is called meth-eth-pro. So what is called? Propyl thio group. propyl thio group. 1, 2, 3. So meth it pro. So the group is called propyl thio group. In this, in the GPAT exam, they will not ask only about propyl thio group. They can ask the core structure also. What is the core structure? Benzdiazole. Also, the other functional group present are amide group and also methoxy group. Okay, so you have to understand the structure. In the structure, what are the different functional group present? You have to understand all them. Okay. So in the first question, the answer is C3H7S. Correct? C. No, it's not C. It's D. I think. Yes, it's D answer. Correct answer is D. Okay. Next question. Choose the correct reaction with their product. So name reaction. Name reaction is very, very important in GPAT every year. Even the last year also one question came, Rosenman reduction came. So in every year you will get 1 to 2 question name reaction in GPAT exam also, in NIPER exam also. Okay. So first of all, Schwartz reaction in this CH3 pair. Okay, Schwartz reaction is all about preparation of alkyl group with fluorine. That is called fluoroalkane. Yes or no? So preparation of alkyl group with fluorine means RF. So Schwartz reaction is all about preparation of RF. So in this question, what is provided? CH3 pair is reacted with AgF and the final product is CH3F along with that AgBr, silver bromide. So the final product is CH3F, that means RF, right? Alkyl fluoride, yes or no? That is called methyl fluoride. So I think this is the correct answer. Next, Stephan reaction. Stephan reaction is all about, can anyone please tell me, Stephan reaction is all about preparation of aldehyde. In aldehyde, you will see R C double bond O single bond H. This is the preparation of, this is the final product of Stephan reaction. And what is there? RCN. Yes, RCN is the reactant along with that essential. So it is also the reagent, correct only. But the product is RCH2NH2. This is wrong. In the product, it should be RCO, RC double bond O single bond H. That is aldehyde. So this is wrong. Next, Clemenson reduction. Can you please tell me Clemenson reduction is all about? Already it is written that reduction. Reduction means our final product will be reduced. Right? Final product will be reduced. Reduced in the sense C. It is C double bond O. So when C double bond O will be reduced, what will form? CH2. Here it is CH2. No, it is CnNH2. So this is not correct. So Clemenson reduction is also wrong here. And Getterman-Koch reaction. Can you please tell me Getterman-Koch reaction? It is also very important name reaction. Getterman-Koch reaction. Remember, you have to remember. In Getterman-Koch reaction, the final product is aryl aldehyde. Aryl aldehyde means it's most importantly benzyl aldehyde. Okay. So the structure will be like this. For Getterman-Koch reaction, the final product is like this: a benzene ring connected to C double bond O single bond H. This is the final. Is it visible? Board is visible or not? So the final product for Getterman-Koch reaction is aryl aldehyde or benzyl aldehyde. Okay. So here is the final product, that is toluene. CH3, when CH3 is connected with benzene ring, that is called toluene. So this is not correct. So only first one is correct, that is CH3F. So the first product is only correct. So the correct name is Schwartz reaction. Remaining all name reaction are wrong. But you have to remember all the name reaction. In the second reaction, Stephan reaction. In Stephan reaction, the final product is aldehyde. In Clemenson reduction, the final product is alkane. And in Getterman-Koch reaction, the final product is aryl aldehyde or benzyl aldehyde. Okay. So the answer will be first one. Let's see the answer. Yes. Answer is A. Next question. Torsional strain energy in ethane. So can you please tell me what are the different repulsion present in the ethane structure? First of all, let's draw the ethane structure. So this is the one carbon, this is another carbon. So in first carbon you will see 1, 2, 3 hydrogen, and in second carbon you will see 1 hydrogen, 2 hydrogen, 3 hydrogen, right? So this is the structure of ethane. Which type of structure is this? Now, in this structure, you will see the repulsion will be present between hydrogen and hydrogen. So when the repulsion is present between hydrogen and hydrogen, it is only what type of repulsion? It is van der Waals repulsion. But when this hydrogen is repulsed with this one, in that case it is torsional repulsion. Okay. So here the value will be 6 kilocalorie per mole. Torsional repulsion in ethene is 6 kilocalorie per mole. Next question. Topicity, identical. Okay, the relationship between two groups in a molecule in which if one or the other be replaced would generate the same compound, then the two groups are said to be homotropic groups. Two groups are said to be homotropic groups. In the homotropic groups, what will happen? If you change the structure, that means it is not about central atom. If there are different side atoms are present, in that case, for example, chlorine or any type, for example, chlorine and fluorine. In that case, you will see one hydrogen. So in other structure, if you see that chlorine is replaced with the other atom, and again it is producing the same structure, then in that case it is called homotropic groups. Okay, so it is called homotropic groups. Yes, homotropic groups. CIB priority rules. So priority of atom bonded to chiral atom as per Cohen-Ingold-Prelog rules. So as per Cohen-Ingold-Prelog rules, you have to understand the priority is given based on, and even in the standard chemistry, the priority is given based on the mass, atomic mass. The atom which is having more mass will be prioritized more. And so here, iodine, sulfur, nitrogen, oxygen, chlorine, and carbon. In that, which one is having more atomic mass? Iodine, then sulfur, then oxygen, then nitrogen. But chlorine is having more mass than nitrogen also and oxygen also, right? But you see, what is that? In standard chemistry, the priority is given based on the atomic mass. But in Cohen-Ingold-Prelog, the priority is given based on the atomic number. So here, iodine is having more atomic number, sulfur is having less than iodine, then oxygen, then nitrogen, but chlorine is having more atomic number than nitrogen and oxygen, even than sulfur. But still it is counted on the least position. Okay, and after that you will see carbon. So the answer will be B. Iodine, then sulfur, then oxygen, then nitrogen, then chlorine, then carbon. Now you have to remember here this chlorine. Chlorine is in different position other than that of remaining atoms. Okay. See, iodine has 53 atomic number, chlorine 17, sulfur 16, oxygen 8, nitrogen 7, carbon 6. But see, in the standard chemistry, iodine, chlorine, sulfur, oxygen, nitrogen, and carbon. But according to that theory, this order is given as iodine, then chlorine, then sulfur, then oxygen, then nitrogen, then carbon. This is about standard chemistry. But when we will come to the theory, which theory? We will come to the Ehrenhanger theory. See, iodine, then sulfur, then oxygen, then nitrogen, but chlorine comes to the second position, and then carbon is there. Okay, so you have to remember that chlorine, it is in the least position. Okay. Next question, both cyclohexane flagpole. This is very, very important. In that question, in that topic, you will get 2-3 types of question, and this topic is very, very important. In that they can ask the internal energy, in that they can ask the stability of the structure, internal energy of the structure, and also they can ask the repulsion between the atoms present on the cyclohexane structure. Okay, so here this cyclohexane has how many structures? Chair, twist chair, half chair, board, twist board form. Yes or no? 4 structures. Out of that, the most stable form is chair form. Yes or no? So here in board form, the cyclohexane. Okay, so how the structure of board form we will draw? See, 1 carbon, 2 carbon, 3 carbon, 4 carbon, 5 carbon, 6 carbon. The structure will be like this. Simple as boat. But here one hydrogen is present, here also hydrogen is present. So how many hydrogen in each structure? Two hydrogen you will see. One hydrogen in horizontal position and one hydrogen in vertical position. So when two horizontal will meet each other, they will repulse each other, and that repulsion is actually van der Waals repulsion. Okay, so the answer will be van der Waals interaction. Okay now. So you have to remember the most stable form is chair form. The most stable form is chair form, and the minimum internal energy present in chair form also. Okay. Next question, ethambutol. So which of the following isomers of ethambutol is tuberculostatic? This is direct question. You have to remember that is SS isomer. What is that S and R? This S and R is, see, I'll show you once again. This is the structure of ethambutol. In that, how many chiral center are present? Two chiral center. One chiral center is there, yes, and another chiral center is there. So can you tell me why it is called ethambutol? Because in the structure, see, one carbon, two carbon. So it. Again, M means presence of amino group. So presence of amino group. Okay. Again, but. So how many carbon? 1, 2, 3, 4 carbon. Same in that side also. 1, 2, 3, 4 carbon. That's why it is called but. And again, all. All means presence of alcohol group. Presence of alcohol group. So this OH present. So sometimes you will get so many drugs in that the name will itself explain the structure. For example, here ethambutol. In that ethambutol, you will see eth, am, but, and all. Right? Now we will see that SS. So what is that S? See, if you see the structure, RS configuration you know very well. In the RS configuration, if the hydrogen is in wedge or dash, if the hydrogen in is dash, for example, see this one is in dash. Dash means behind the board or behind the plane. In that case, so we will start prioritizing from having more atomic mass. So here this hydrogen is connected with carbon. Again this carbon connected with this carbon. This carbon again connected with oxygen. So this is having number 1 priority. Okay, this is not no. First we will take this nitrogen because these are carbon. So nitrogen is having more atomic mass than carbon. So this nitrogen is having number 1 priority. Then number 2 will be coming this carbon. Number 3 will be this one. Now if we rotate this, it will be in anti-clockwise. So when the least priority is in dash behind the board, and we will see the priority and the conformation is in anti-clockwise. That is, anti-clockwise means opposite to the clock direction. In that case, if the minimum priority is in dash form, then it is considered as S. And if this minimum priority is in wedge form, that is above the plane, and this configuration is again anti-clockwise, in that case we will consider is at R. So now here it is S form. Okay now. Now we will see this one. Again this hydrogen is, so first we will do the priority. So priority will start from nitrogen, having highest molecular weight here, nitrogen, carbon, carbon. Among these three, this nitrogen is having most molecular weight, so we will consider as 1. Then this carbon is having another carbon, but this carbon is having oxygen, so this carbon we will consider as 2, and this carbon we will consider as 3. Again this least priority is in dash form, so this we will consider again 1, 2, 3. If we go like 1, 2, 3, then it will be again in the anti-clockwise. So if the least priority is in dash form and it is in anti-clockwise direction, then again it is S form. Okay, so S both are in having S configuration, and when both are is having S configuration, it is most reactive in the body. Okay now. So see, ethambutol is an anti-tubercular agent with 2 chiral center. So what are the 2 chiral center? This number 1, this number 2, having 2 chiral center. This dextrose D form is the active isomer, and SS configuration responds to the D form in the molecules numbering. So both are important for the structural activity relationship or its biological and therapeutic activity. Pharmacological, biological and therapeutic activity. Okay. I hope you understood. Any doubt up to this? Next, assign EZ configuration for the following compounds. So what is EZ? Can you please tell me if this is in trans, then it will be E or Z? Okay, I'll tell you how to solve this one. In that, first of all, we will see the CIP rule. Again, priority. So this in this case, I told you already mentioned earlier in general chemistry and in standard chemistry, that configuration, sorry, the priority is given mainly based on the molecular mass. So here, this chlorine is having more molecular mass or atomic mass, or this hydrogen is having more atomic mass? Definitely chlorine. So chlorine we will prioritize as 1 and hydrogen as 2. Here again bromine and CH3. CH3, that means methyl. In that CH3 the central atom is carbon and here the central atom is bromine. So bromine is having more atomic weight, right? So in that case bromine will be considered as 1 and this one is considered as 2, right? Now see, both 1 and 1 are in same side. That means if you put a mirror here, then both the 1 and 1 are in same side and 2 and 2 are in, that means high priority group on the same direction and low priority group are also on the same direction. That means it is cis, and when it is cis, it will be considered as Z. Okay. The second one, in that carbon and CH3. So this carbon is connected with another carbon. So we will prioritize as first. And this carbon is connected with hydrogen only, 3 hydrogen. That means carbon is connected with hydrogen. So we will prioritize as 2. Second priority, first priority. Here, this CO is carboxylic acid. So carbon is connected with oxygen. Definitely more priority, first priority. And this is only hydrogen. Atomic mass is very less. So it is least priority, the second. So now see again. 1 and 2 are in same side. That means 1 and 1 are in same direction or in opposite direction. Both are in opposite direction. When it is opposite direction, it is trans. And when trans, we will consider as E. So what will be the correct answer? First one is Z and second one is E. So what is the correct answer? Z and E. Right? So the answer is B. Correct. So happy B. Yes, you are correct. Next question. E1CB. So can anyone please tell me what is the full form of E1CB, or what does that E1CB means? Elimination unimolecular conjugate base. So elimination will be done by using conjugate base. Okay. So E1CB mechanism involves the formation of carbocation intermediate, carbanion intermediate, transition state or free radical. What will be the answer? Carbocation or carbanion? Carbanion. Yes or no? Why carbanion? Because from that carbanion, again, the least leaving group or the weak leaving group will be released from the beta carbon. See, now I will tell you the explanation. See, the answer is carbanion intermediate. Why carbanion intermediate? In that E1CB, now I will tell you, I will explain you the mechanism of E1CB, okay? You need to understand that. Is it visible or not? Yes. Let's see. So in E1CB will be completing in 2 steps. In first step, you will see this is carbonyl group connected with an alcohol. Yes or no? So from that what will happen? So when there is a carbonyl group connected with a carbon, the first carbon is called alpha carbon and second carbon is called beta carbon. Right? Is it visible or not? I think I should write in little bit. So for example, this is a carbonyl group. This is a carbonyl group. In that carbonyl group, you will see 1 carbon, 2 carbon connected. The first carbon is called alpha, second carbon is called beta. If in that beta position or beta carbon, if any weak leaving group is present, For example, OH. Hydroxyl group is a weak leaving group, and strong leaving group is chlorine. Cl is a strong leaving group. So here this weak leaving group will live in the second step. In the first step, what we will do? In the first step, we will form, not we will form, in the chemical reaction, carbon ion will form. That carbon ion will be intermediate. Now we will see. So see, this is the structure. From that, what will happen? In the presence of base. Base means hydroxide. What will happen? This hydroxide will come. First of all, this is oxygen, more electronegative. So more electronegative means del negative will be there. Partially negative charge will be there. And this carbon will be partially positive. So del positive, del positive, del positive. This carbon, right? Now what will happen? This OH from the base will come and it will bind to the positive side. Because OH is negatively charged, it will come and it will bind to the positive charge, right? When it will bind to the positive charge, what will happen? This will leave. And when it will leave, what will happen? A carbon ion will form. See here, after the binding of this one negative charge, what will happen now? Transfer of negative charge will take place. That is called metamerism. And after that, what will happen? This O negative will form here. And presence of this O negative is called formation of carbon ion. So this is the intermediate and this is the first step. Now in the second step, what will happen? This carbon ion is already present, O negative. Along with that, a weakly basic charge, a weakly leaving group is connected. At the beta position, if it is connected to alpha position, it will not leave. If it is connected to gamma position, it will not leave. When it is present at beta position, it will leave, and that is called RDS. By in the presence of reagent RDS, it will leave and it will form a alpha beta conjugate carboxyl group. Okay, now we will see in step 1, a base removes a proton to form a carbon ion. The conjugate base, that is after formation of carbon ion, that is only called conjugate base. The first, if the hydrogen is acidic, and then loss of the leaving group, that is weakly leaving group, loss of the leaving group from the carbon ion to form the double bond, that is alkene product. So here the double bond is formed, right? So this is the double bond, the formation of this double bond. So in that, any time you will see in any elimination reaction, when any atom will eliminate, there will be a formation of double bond, right? Normal E1, E2, in all these things you will see the same thing, that formation of alkene and alkyne, correct? Is it clear or not? Up to this, if you have any doubt, you ask me. Now we will see the next question. State whether the below compound is aromatic or not. Very, very important question. Aromatic, non-aromatic, anti-aromatic. You have to understand this, and this topic is very important. Okay. So what are the different rules for a compound to be aromatic or non-aromatic or anti-aromatic? The first thing is there, to be a compound to be aromatic, it should be planar. Number one thing, it should be planar. It should be planar. Second thing is, it should be in conjugation. It should be in conjugation. So what are different types of conjugation? Pi, sigma, pi sigma lone pair, pi sigma positive charge, pi sigma negative charge, pi sigma free radical. These all are different types of conjugation. You have to remember 1, 2, 3, 4, 5. Okay. So in that, see, pi sigma pi, sigma pi, sigma pi, sigma pi. Up to this, it is correct. But now see, after that, there should be a pi bond present, yes or no? But there is no pi bond present. So what is happening? If it is even in the plane, but it is not following the second rule. What is the second rule? The compound should be in conjugation. So pi sigma pi, pi sigma pi, pi sigma pi, and here pi sigma, sigma sigma. So there is no presence of pi bond, correct? So since it is not following the second rule, it will be definitely coming under non-aromatic. So the answer is B. Now let me tell you the other rules also. The first rule is the compound should be in plane. Second rule is the compound should be in conjugation. Number 3, the compound should have 4n plus 2 pi electrons. If the compound is having 4n plus 2 pi electrons, then it is called aromatic. And if that compound is having only 4n number of electrons, that is called anti-aromatic. And if that compound is neither having 4n plus 2 nor having foreign electrons, pi electrons, then it is called simply non-aromatics. This is third condition. The first condition is anyhow the compound should be aromatic, so in plane. For example, if you take benzene, see, benzene, it is aromatic, everyone knows, universal structure. In that, see, this benzene is in plane, definitely 6-membered structure, it is in plane. Second thing is that this benzene is having pi sigma pi sigma pi sigma pi conjugation. Yes, correct. Third thing, the benzene is having how many pi electrons? One, let's count. In one bond, how many electrons are there? 2 electrons. So 1, 2, 3 bonds are there. How many electrons are there? 6 electrons. So 6 electrons means 4n plus 2 rule. So in that case, if we put that value of n as 1, so 4 into 1 plus 2. So 4 plus 2, that means 6 electrons. So in that case, this benzene is fulfilling the third rule also, right? 4n plus 2 pi electrons. Yes or no? So since it is following 4n plus 2 pi electrons, first, second and third all rule, it is aromatic. Okay? Up to this, any doubt? If you have any doubt, you can ask me. So next question. Next question. Identify the statements that are incorrect regarding SN1 and SN2 reaction mechanism. All SN1 reactions are of first order reaction. Definitely. That's why they are called that one. This one is because of first order. All SN2 reactions are of second order. Correct. Both are correct. Okay. Next, reaction rate in SN1 determined by the electronic factor. Yes, this is the only factor which will determine the rate of the reaction. This is called RDS, that is rate determining step. In that rate determining step, these electron factors are very, very important. So these all the 3 steps are correct only. Reaction rate in SN2 determined mainly by steric factor. No. In SN2, 2 factor will be there to determine the rate of the reaction. Okay. That's why it is called second order reaction. Correct? So what it is saying, that reaction rate in SN2 determined mainly by steric factor. No. In that SN2 reaction, you know SN1 is 2-step reaction, but SN2 is single-step reaction. In SN1, that is in 2-step reaction, the first step will be leaving group and second step will be joining group. But in the case of SN2 reaction, it is single-step reaction. In one step, simultaneously both the step will come. In that case, one attacking group will also come, and when attacking group will come, there will be an intermediate structure. In that, carbon will be having 5 bonds. Okay. After that, since carbon is normally having 4 bonds, yes or no? So 4 bond carbon is stable. Why? Because they are called tetra. No, nobody is responding. Please reply. So carbon is generally having 4 bonds. In that case, carbon is stable. But when a carbon is having 5 bonds, definitely one bond has to be broken, or else it will be unstable. So what will happen in that case? When attacking side will come, one leaving group will be leaving that structure easily. So simultaneous reaction will take place. Okay, so rate of reaction will be based on this first thing also, that is attacking reagent also, and leaving, that is stability of the carbocation also. Okay, so this SN2 reaction is determined by 2 factors. So the incorrect answer is 5D. Answer D. So answer is D. Okay. Next, IUPAC name of anisole. IUPAC name of anisole is methoxytoluene, dimethylbenzene, methoxybenzene, and methylbenzene. So what is the structure of anisole? Very simple. You will draw a benzene, and when this benzene is connected with a ether group, that is methoxy. See, methyl group is connected with oxygen, and this is an ether group, so it is called methoxy. So simply it is called methoxybenzene. So the IUPAC name of the anisole will be methoxybenzene. So C is the correct answer. Okay. No, it's not methoxytoluene, it's methoxybenzene. See, any cell structure. So in that methoxybenzene. Okay now. Next, we will see the next question. So heterocyclic ring in timolol. So what is the heterocyclic ring present in timolol? Can you please tell me what is timolol? Timolol is beta blocker or alpha blocker or calcium channel blocker. Response fast. So timolol, it is having, see, this is the structure of timolol. In this, the core structure, that is called structural scaffold. The structural scaffold is this one. What is that? Thiadiazole. This is thiadiazole. Yes or no? Thia means sulfur. The presence of sulfur is thia. Let me make it little bit large. So in this, see, presence of sulfur means thia, and presence of nitrogen means aza. How many nitrogen? 2 nitrogen. So thia, dia, and how many? What is the number of members present in that ring? 5 member. So when 5 member, it is all. So thiadiazole. Yes or no? Yes. Now this is the main core structure present. Along with that, you will see this one. So let's see the structure. Timolol is a non-selective beta blocker. See, timolol is a non-selective beta blocker. Its chemical structure contains a morpholin ring connected via an ether linkage to the thiadiazole ring. See, so chemical structure mainly is thiadiazole, which is connected with the morpholin, and along with that you will see one ether ring. This ether bliss connecting the, what is this? This is amino group, yes or no? And this is isopropyl group, yes or no? 1, 2, 3. 3 carbon are there, and they are connected as isopropyl bond, isopropyl group. Okay now. So this isopropyl group is connected to this amino group. So this is simply you can call isopropyl amino. Again, this is connected with ether group to the thiadiazole ring. Okay now. So what is the main ring present here? That is thiadiazole. The answer is 1, 2, 5 thiadiazole. Okay, now why 1, 2, 5? So numbering will start from this one. So 1, 2, 5. Next, what is the next question? Chiral centers present in Griseofulvin. So how many chiral centers are present in Griseofulvin? See, this is the structure of Griseofulvin. So can you please tell me how many chiral centers are present? Yes, 2. What are they? So what is the main condition for a compound to have chiral centers? First one, the center, that is carbon, which is present at the chiral center, it should be sp3 hybridized. So can you please tell me, this one is sp2, 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 all are sp2 hybridized. So sp3 hybridized carbon only one, this one, and the other one is this one, right? Again, this one is also sp2, but the second rule is that carbon should have all 4 bond is having different groups. Okay, so here in that carbon 2 hydrogen are present, so this is not chiral. In that carbon, one is hydrogen, another is CH3 group, another is carbon connected with this one, and another is carbon connected with this complete ring. So this is different. So this carbon is a chiral carbon. Again, the second chiral center is this one. See, this carbon is connected with this carbon, but this is connected with complete this structure. Here this is also carbon, but you have to see if it is same carbon, then you have to see the next structure. So in the next structure, you will see all these ring present. In the same way, there is oxygen and there is carbon, but connected with the different ring. So these two are the different chiral center present. Remaining sp3 structures you see. This one is also sp3 but having 3 hydrogen. This one is also sp3 having 3 hydrogen. That means there should be all different groups connected with the all different 4 bonds. Yes, sp3 double bond to oxygen. So this one is single oxygen, single bond. Okay, this is not double bond. This one is correct, and this one is correct. Okay, now. So 2 chiral center are present. Next question. Match the following name of purine chemically. Match the following name of purine chemically equal to. So adenine. Adenine is 6-aminopurine. Guanine. Guanine is 2-amino-6-hydroxypurine. Next, hypoxanthine. Hypoxanthine is 6-hydroxypurine. Same. Next, xanthine. Xanthine is 3,7 dihydroxypurine 2,6 diol. This is ketone group. That's why this diol came. Okay. So this is like the same only. P1, Q2, R3 and S4. So what is the answer? P1, Q2. Yes. So A will be the correct answer. Yes, A will be the correct answer. Next, match the suitable starting material for the synthesis of following adrenergic drugs. Suitable material. So in that starting material, salbutamol, ephedrine, amphetamine and prazosin. So in that, this salbutamol is, I think, this methyl salicylate. Yes. So synthesis of salbutamol reactant is methyl salicylate. Okay. Next, ephedrine. Ephedrine is by propiophenol only. Next, amphetamine. Synthesis of amphetamine is done by phenylacetone. And next, prazosin. So prazosin is done by 4,5 dimethoxy anthelmintic acid. Okay, you have to remember all the synthesis reaction also. Not all actually. Some important synthesis are there. You will get that synthesis in your even university syllabus also. These are very, very important. It's not necessary to remember all the synthesis. So what is the answer? Answer is B only. Next, cephalosporin fused ring system. In cephalosporin, the beta-lactam ring is fused with thiazolidine ring, dihydrothiazine ring and thiazole ring, all of these. What will be the answer? Dihydrothiazine ring. Why? So what is that? Cephalosporin. What is the structure of cephalosporin? See, cephalosporin comes under which class of antibiotics? Beta-lactam antibiotics. First of all, you have to draw the beta-lactam drug structure. Why it is called lactam? Can you please tell me what is lactam actually? What is lactam? No, thiazolidine is for that penicillin, and that dihydrothiazine is for cephalosporin. The question is asked about cephalosporin. Okay, can you please tell me what is lactam? Lactam is the cyclic amide structure. See, what is if C double bond O is connected with nitrogen? Already I have mentioned just few minutes ago. Then it is called, this functional group is called amide functional group. And when this amide functional group is in cyclic structure, see this is open, right? For example, CH3, CH2, C double bond O, single bond NH2. So in that case, this is open, right? So you can say propanamide. It is propanamide. How many carbon? 1, 2, 3. So propanamide. Why it is called propanamide? Amide because of C double bond O is connected to amine group. Now, if this propanamide is in cyclic structure, that is cyclic amide structure, in that case it is called cyclic amide, and that cyclic amide is simply termed as lactam. Okay. So for example, here see carbon, carbon, carbon and nitrogen, right? So if you take this carbon and connect with this nitrogen, what will be the structure? Carbon C double bond O, and this carbon is connected to CH3, the CH2. Yes, CH2. This CH2 is connected with again CH3. But now what will happen when it will come bind with the nitrogen? This one hydrogen will remove. So CH2, and then this is connected to this nitrogen. Yes, this is lactam ring or not? This is this one or not? Same thing. Okay, now. Now, I already mentioned 2 minutes ago that this carboxyl group is connected to the next carbon, that is called alpha carbon, and the next carbon is called beta carbon. Now we will see this beta carbon is connected with the heterocyclic structure, a 6-membered structure like this. Yes or no? This 6-membered structure is connected to the beta carbon. That's why it is called beta-lactam ring. Okay, or beta-lactam antibiotic. Now it is again connected at numbering will start from here 1, 2, 3, 4, 5, 6, 7. In that you will see one amino group is connected, and it is again connected to carboxyl group, and that is again connected to R group. This is simply the structure of cephalosporin, right? So this is in that this is presence of sulfur. Sulfur means thia. Presence of nitrogen. Nitrogen means aza. So thia, aza. Now, if it is all means 5-membered ring. So when you will draw the structure of paracetamol, you will see like this. This is 5-membered or 6-membered? 5-membered. That's why it is called thiazolidine. Thia means presence of sulfur. Aza means presence of nitrogen. All means 5-membered. And idine means presence of amine group. Okay now. But when you will see 6-membered, 6-membered is denoted as dihydrothiazine. This presence of in means 6-membered. Okay now. So in that case you will see dihydro. Why it is called dihydro? Because you will see one double bond is present here. If this double bond is not there, that means what is happening? 2 hydrogen are connected here. So when 2 hydrogen will be connected here, this double bond will be removed. That's why it is called dihydrothiazine, in, and again INE. NE means presence of amine group. I hope it is clear. If you have doubt, you can ask me again. So what is the answer? Yes, the answer is dihydrothiazine ring. Okay now. See, this is the structure again. Already I have explained everything. I have explained the main core structure, but I didn't write that functional groups. Okay now. Let's see the next question. Relationship between del G, del H and del S. So this question is mainly from which topic? Can you please tell me? Gibbs free energy. In that Gibbs free energy from physical chemistry. In that Gibbs free energy, this del G means Gibbs free energy. Del H means change in enthalpy. Enthalpy is a type of energy, and del S is entropy, change in entropy. Entropy means its kinetic energy, its stability and unstability. So when it is more unstable, the small particles present inside the solution. When it is more unstable, it is having more entropy. When it is stable, it is having less entropy. Okay. So del G. So simply in Gibbs free energy, we will get an equation that is del G equals to del H minus T del S. So in that case, what is related actually? For example, you will take a solution in a tub. You will take a solution, solution, water, and along with water you will put some powder or salt or anything, sugar. Now, if you put keeping the temperature below this pot, what will happen? After some time, this solution will start boiling. Before boiling, if you watch and observe it closely, you will see the solution. Inside the solution, there is something. Some particles are bombarding like this. They are moving or showing some zigzag rotation. Okay, zigzag movement. In that case, what is happening? The kinetic property of the particles present inside the solution are increasing. Okay, now. So that means the kinetic property will increase. This kinetic property is related to the temperature, yes or no? When temperature will increase, kinetic property will increase. When kinetic property will increase, definitely entropy will increase. And along with that, enthalpy will also increase. Yes or no? Yes. So enthalpy is overall energy. And that entropy is the energy which is just starting after the applying of temperature and just before the boiling of the solution. In that case, how can you find that Gibbs free energy? That means how much energy you put or how much energy you added inside the solution by using the temperature or by using the heat. You can easily denote that del G by what it is called subtracting the final subtracting the temperature, whatever the movement of the particle was taking place just before boiling of the solution. Yes or no? So in that case, you can easily calculate that del G by subtracting the movement of the particle. That means entropy. So T del S. subtracting T del S, T del S from the entropy or from enthalpy, that means energy which is just before boiling of the solution, that means del H. So del H minus T del S. So by this way you can calculate how much energy is gained inside the solution by using the heat behind the pot. Okay, so this is gives free energy, and you will get only equation from this topic. Actually from these topics already previously questions are there, and even if you are writing different test also, mock test, in that also you will get questions from that gives free energy. In that you will simply get the formula only. That formula, if you remember, lifetime it is. Okay, so del G equals to del H minus T del S, you have to remember that. So what is the answer? Option B is the correct answer. Del G equals to del H minus T del S. That is universal. You have to remember that's universal. So see here the same thing. What is that heat is transferring to cold solution. Heat is transferring, and the flow of heat, how much it is gaining. Sorry, how much a free energy is gaining, and how much it is gained. How to calculate all these things? You can get it very easily. Okay. So here simply one remember the formula. That's it. Del G equals to del H minus T del S. Next, in Venn-Dimeter equation, A represents. So what is Venn-Dimeter equation? It is present in spectroscopy. Okay, you have to remember it is present in spectroscopy, and you will get a formula in Venn-Dimeter equation. That is, an equation is there. You have to remember that equation is very, very important. The equation is this one: H equals to A plus V by U, A plus B by U plus Cu. Okay. So this Venn-Dimeter equation, yes, Venn-Dimeter, actually I forgot that Venn-Dimeter equation is present in chromatography, not spectroscopy. It is present in chromatography, and it is used to determine the mass and its quantity of different components. Okay. Next, which antihypertensive contains 1,5-benzothiazepine ring? 1,5-benzothiazepine. Benzothiazepine means again benzene ring is fused with a, how many members? See, IN is there. In is there. In means 6 member. And what are there? Thia means sulfur will be there. Aza means nitrogen will also be there. So what will be the structure? See, the structure is like that. This benzene ring is connected with, where is the structure name? Okay, 1,5 benzothiazepine. Okay, so in that 1,5 at the position, benzo means presence of benzene, thia means presence of sulfur, aza means presence of nitrogen, AF means 7 member, and INE means presence of amino group. So in that, this benzene ring is fused with the 7 member structure 1, 2, 3, 4, 5, 6, 7, right? And this 7 member structure is having 1 sulfur and 1 nitrogen. That's why thia-aza. I hope you got that same structure, 7 membered ring along with connected with the benzene, that is benzodiazepine. And that benzodiazepine is present in drugs acting on CNS. Yes, it is an antidepressant. Correct? Anxiolytic or antidepressant? Antidepressant drug. So this benzene is connected with benzothiazepine ring. And what is the answer? The answer is diltiazem. So in diltiazem you will see this is the main core structure, that is structural scaffold, benzothiazepine. And this benzothiazepine is connected with iso, what is that? 1, 2, not iso, actually 1, 2. So 1,1 dimethyl amino group. 1,1 dimethyl amino group. And here you will see an ester group present. So that is methoid. Methoid means ester group present. And here you will see one benzene again connected with the ether group. Ether group means methoxy. So methoxybenzyl. You will say methoxybenzyl. And here you will see methoid. Okay. Where is the name? See. Diacetyl. Okay. So diltiazem, only member commonly used. Where is the name? See, 1,5 dibenzothiazepine core structure, and it is used for hypertension, angina, and atrial fibrillation rate. There is no IUPAC name mentioned. It's okay. So in the IUPAC name, you will see that N. Okay, I'll tell you the IUPAC name. See here. Numbering will start from according to O, S, N, P. Numbering will start from sulfur. So 1, then 2, 3, 4, 5. 1, 2, 3, 4. So 1, 2, 3, 4, 5, 6, 7. Correct? Now, in that you will see at 4 position 1, 2, an ethyl bridge is there. See, this is the ethyl bridge, and this ethyl bridge is connecting N, comma N. What is this? N, comma N dimethyl amino. So N, comma N dimethyl amino ether. N, comma N dimethyl amino ethyl. That is at which position? 4 position. So 4 N, comma N dimethyl amino ethyl. Again at 5th, 6th position methioate will be there, and again at 7th position, so 7 methio. Again at 7th position methoxybenzyl group is also there. So 7 methoxybenzyl, and then simply you will say benz 1,5 benzothiazepine. At 5th position, 1 ketone group is also there. So own. At last you will mention own. Okay. So 1,5 benzothiazepine own. Next question. Revolution per second of magnetic moment vector around H0. So coupling constant, flipping from precessional frequency and gyroscopic motion. I think the answer is precessional frequency. Yes, it is precessional frequency. So you have to remember that formula. Okay, this is very, very important. This is direct question actually. Next, type of cycloaddition, Diels-Alder reaction. So what is Diels-Alder reaction? In this, the cycloaddition will take place, and the addition will be 4 plus 2. You have to remember, this is very, very important. This point, only this point, 4 plus 2 reaction. It is also called 4 plus 2 addition. It is also called Diels-Alder addition, and it is also called cycloaddition, for 4 plus 2 cycloaddition. And also you will see that is called alpha plus beta addition. Okay now? You will get this in name reaction also, and it is very, very important. Next, select the base peak. Molecular weight is 72. So in that case, you have to remember the base peak will be the peak which is having maximum intensity. The peak which is having maximum intensity, or you can say maximum amplitude, that is only base peak. So there is any graph? No, the graph is missing. In that, you have to calculate this peak is measured based on the molecular weight upon its atomic number. So if the molecular weight upon atomic number is maximum, that is will be showing base peak. Here 72, 29, 57 and 73. So the answer is molecular weight upon atomic number. When the atomic number will be more, molecular weight will be less. Right? Sorry. For example, M by Z. If we are getting the final answer is 29, that means if this Z value will be maximum, if the Z value is more and M value is normal, then the result will be less. That means numerator by denominator. When denominator is more, result is less. When numerator is more, result is more. And when denominator is less, result is more. So in that case, this Z value is more, right? This one. In the case of 29. So that 29 is the correct answer. Okay? Yes. Next, decreasing basic character of amide. This question is very, very important. Even last year in GPAT 2025, one question came from the basic structure. Okay, actually that is called basic strength. Last year one question came from the basic strength. All these things are same thing based on the electronic effect only. And this electronic effect is very, very important. You have to understand that. In that you will see inductive effect, mesomeric effect, hyperconjugation and resonance. Okay, so inductive effect, mesomeric effect, and hyperconjugation, these things are very, very important. And the basic character, that is called acid stability, basic stability, acid strength, basic strength, these things are very, very important. You have to practice some question before going to the exam. Okay, so here the decreasing basic character of the amines. For example, first one is CH3NH2. So first of all, what is basic character? A base will release H plus or OH minus. A base will release OH minus, and an acid will release H plus. But a base will accept H minus, H plus, and acid will accept OH minus. Totally opposite. Simply see. Yes, acid base. Acid will release H plus. Acid will release H plus, and acid will accept OH minus. In the same way, base will release OH minus and base will accept H plus. Okay, you have to understand these things and you have to remember. Now here NH2 is there. This is aniline. In that there is no OH present, right? So what it can do, if there is no OH present, that means it can only accept H plus, right? So when H plus will be accepted when there is something negative charge present. If any negative charge is present or any electron density is more, in that case less electronegative or positively charged component will come and attack here, right? Yes or no? So if we are donating electron, if we have any group which is donating electron, for example CH3, CH3 will be showing plus I effect. Plus I effect means it tries to donate the electron to the central atom. In that case, it will be having more electron density. Here benzene ring is there, it will be also showing more, it will be also donating more electron by through the resonance. So resonance is more important than inductive effect. So it will be also stable, that negative charge and easily H plus will come and it will attack. Here you can see this benzene ring is different, and here this nitrogen is having one lone pair, but it is not in the resonance because there is no pi sigma pi conjugation, right? Here if you see, there is this nitrogen is having lone pair, but it is not in conjugation with this one also, and it is not conjugation with this one also, but this carbon also, this carbon also. That means it is totally different. So negative charge on this will be totally unstable, and there is no negative charge, very less negative charge will be there. Yes or no? So in that case, it is totally different from this one. So this one will be having high basic character. This one will also be having high basic character. This one will also be having high basic character. But before then, this one will be there, right? So what will be the answer? See, the option D. Decreasing. Decreasing means from high to low. So low will be which one? This one, right? So what are the options? 1, 2, 4, 3. 1, 2, 3, 4. 1, 2, 3, 4. 4, 1, 2, 3. So in that case, see, same question coming again. Okay, so here the final answer is 1, 4, 3, 2. That means 1 is having maximum effect, then 4, then 3, then 2. Why? See, I will tell you. This is already donating, this CH3 is already showing plus I effect. That means it will try to donate electrons. It will try to donate electrons means there will be negative charge present. Correct? So when negative charge is there, easily H plus can come and it will attack. Okay. After that, this nitrogen is having lone pair here. So lone pair means already electron rich. When lone pair is there, that nitrogen can easily donate the lone pair to the H plus and they can make a bond between them. So that's why H plus can come here also and it can easily make bond. But here if you see, this nitrogen, it is having lone pair, but this lone pair is in conjugation with this ring. So when this lone pair is in conjugation with this ring, what will happen? This lone pair will be involved in the conjugation. So when it is involved, this lone pair is not present continuously there. It is not present continuously. Sometimes it is going, coming like this. Sir, previous question 1 explains peak base question. In peak base, see, you have to remember that is done by dividing m, that is molecular weight, upon atomic number. Molecular weight upon atomic number. When atomic number is more, that means Z value is more. When Z value is more, that means denominator is more. And when denominator is more, that means final result is less. Okay now. And when Z value is less, that means denominator is less, that means final value will be more. So in that case, that one is having 29. So 29, that means it is okay. Yes, this one. So what are the other results? 72, 57, 73. All the results are more than 29, correct? All the results are more than 29. That means that Z value is less, that Z value is also less, and this one is also less than this one. Since it is having more Z value, definitely it will be showing that peak graph. Okay, now that's why that final value is 29 only. You understood that? So here, this one is having maximum, then this one, and then this one. Okay. So first 1, then 4, then 3, and then 2. Okay. Any doubt? See, it is written there already. Inductive quasi effect, inductive effect, then resonance, and then steric hindrance. That already I have mentioned just. Same question coming again. Next, IUPAC name. IUPAC name of the following compound. So for IUPAC name, what you have to do? First, you have to consider the most priority functional group. So out of all the functional group, this carboxylic acid group is highest priority group for IUPAC naming. So from here we will start considering. So 1, 2, 3, 4, 5, 6, 7. What is that 1, 2, 3, 4, 5, 6, 7? For IUPAC naming, you have to consider a parent chain. Then parent chain should be longest chain, and that should be having highest number of carbon connected to it. So here how many carbon? 1, 2, 3, 4, 5, 6, 7. And this carboxylic acid is the highest priority group. So that's why we will start numbering from this side. Okay. Now you will see at 6th position another methyl group is also there, nitro group is also there. At 5th position hydroxy group is also there, methyl group is also there. Okay. Now see, heptane, all are heptane. That means 7 number of carbon, correct. Second thing is that at 5th position hydroxy group is there and methyl group is there. So at 5th position hydroxy group is there. 3rd position hydroxy, no, wrong. 5th position hydroxy, correct. 3rd position hydroxy, no, wrong. So these two are correct. 5 hydroxy. Now you will see at 5th and 6th position two methyl group are also there. So 5 hydroxy, 5,6 dimethyl group. Correct, na? 5 hydroxy at 5th position, 5 hydroxy. Next at 5th and 6th position, 2 methyl group are there. So 5,6 dimethyl, and again at 6th position 1 nitro group is there. So 6 nitro heptanoic acid. Why heptanoic acid? Because of presence of carboxylic acid. So what will be the correct answer? B. Right? Are you getting my point? Is there any doubt? So here the correct answer is B. 5 hydroxy, 5,6 dimethyl, 6 nitroheptanoic acid. Okay. Let's see the next question. So yes, correct answer is B. Next, coupling constant for trans protons in NMR. So in NMR, the coupling constant, the answer is 12 to 18 Hz. That is direct question. You have to understand and you have to remember that. Okay. Next, Beard-Lambert's law calculation. So what is Beard-Lambert's law? Okay, a solution has eta 1.2 into 10 to the power 4 liter per mole per centimeter at 280 nanometer. Path length is 1 centimeter. Absorbance is 0.5. Find the concentration. So Beard-Lambert's law is all about concentration. Okay, in that Beard-Lambert's law, you will see a formula that is A equals to absorbance equals to eta into concentration into path length. Okay, so now concentration equals to absorbance upon eta into path length. What is the absorption? Absorbance 0.5. Already it is given. What is eta? 1.2 into 10 to the power 4. What it is also given. And what is path length? Path length is 1. Yes. Now, if you calculate, you will easily get that. So C equals to 4.16 into 10 to the power 5. Now, can you please tell me that Beard's-Lambert's law? In that Beard's-Lambert's law, what is Beard's law and what is Lambert's law? Beard's law tells that if the concentration of sample is more, then absorbance will be more. And when absorbance will be more, transmission of light will be less. So that means transmission of light is inversely proportional to concentration of the sample. See, for example, there is a sample. In that sample, you put some light. Now this light will be absorbed also. Some will be absorbed, some will be transmitted, some will be reflected also. Okay now. Now if you are taking in a test tube, if you are taking some solution, in that solution, if this solution is totally dark or having more high concentration, in that case what will happen? The light will be absorbed more, yes or no? And if the light is absorbed more, that means transmission of light will be less, definitely, yes or no? So the Beard's, according to Beard's, Beard's telling these things only, that when the concentration of the sample is more, that means the transmission of light will be less. And according to Lambert's, if the thickness, path length, if the path length of the sample is more, in that case also transmission will be less. Why? Because if the sample is having more path length like this, that means what will happen? Now if some solution are present inside the sample, now what will happen? If you incident the light on the solution, obviously more path length it has to go, and when path length is more, definitely more light will be absorbed here and less light will be transmitted, correct? So according to Beard's, there if the transmission is inversely proportional to concentration, and according to Lambert's, the transmission is inversely proportional to path length. When more path length, less transmission. When more concentration, also less concentration. Less transmission. Okay. I hope you understand that Beard's Lambert's law. Now, open tubular GC column outer layer. This is direct question, informative question only. So, open tubular gas chromatographic columns, in that the outer layer is constructing by polyimide, silica glass, aluminum and plastic. So what will be the answer? Silica glass, polyimide and aluminum, right? Yes, the answer is polyimide and aluminum. Next, indicator in diazotization titration. So what is diazotization titration? You know what is diazotization reaction? In that reaction, diazonium salt will be formed. Okay, but whenever you are doing the titration, in that case, you will calculate the concentration, you will calculate the amount of the substrate, that is diazonium salt. Okay, so now here in that titration, the indicator which is used is starch iodide paper. Critical functional group of all diuretics. This is very, very important. This is structural based question. So in all functional group of diuretics, what will be the function? In all the diuretic structure, what will be the functional group? The functional group is sulfone moiety, right? See, if this is the sulfonyl group, in that case, what will happen? See, this S double bond O NH. This is called sulfonamide. S double bond O is sulfur, and when along with that this NH2 is connected or NH is connected, that is called sulfonamide. And this sulfonamide group is the critical or main functional structure or main functional group in the chemical structure of that diuretics. Okay. Next, conversion of 1,3-butadiene into cyclobutene. Simply, acyclic. That is not, see, 1,3-butadiene. So 1,3-butadiene structure will be like this. 1, 1, 2, 3, 4. Now 1, 3. 1, 2, 3, 4, like this. So in that case, what is happening? At first carbon you will see a double bond, and in third carbon you will see another double bond. That's why diene are there, and both the diene are present at one and first and third position, right? So 1,3-butadiene. This is acyclic. Yes, it is not cyclic. Now, when this acyclic structure will be transformed into cyclic structure, then what will happen? Addition, substitution, pericyclic or rearrangement. What will be the answer? Pericyclic reaction will be there. Correct? See, pericyclic structure, pericyclic reaction. In that, acyclic structure will be converted into cyclic structure. Next, C2 epimer of D-glucose. So, what is C2 epimer of D-glucose? See, it is D-glucose. Epimer are stereoisomer that differs in configuration at only one chiral center. The glucose and mannose differ only at carbon, that is second carbon. See, this is the structure. This is first, second, third, fourth, first, second, third, fourth, fifth, and sixth carbon. In the second, you will see that OH is present on the right side. Correct? But when you will see on the other structure, you will see that OH is on the other side. See, here it is on the below side, and here it is on the right side. So when it is on the left side, it will be on the upper portion. Okay. So that is second OH is totally transferred. So that is called epimer. And if it is in the first carbon, that is first center or C1, in that case it is called enomer. And if it is in the C2, it is called epimer. So you have to remember which two different examples you have to remember in that, which one is epimer of other structure, which one is enomer of the other structure. Okay, you will get in biochemistry. Melanin is derived from which of the amino acid? A simple question, direct question. Melanin is derived from which of the amino acids? Tryptophan, tyrosine, histidine, and valine. So the answer will be tyrosine. See, in that, this is the structure of tyrosine. Okay, so in that you will see a benzene as core structure, and this benzene and alcohol group will be there. Okay, and above that you will see 1, 2, 3. So a 3-carbon structure will be there, and in this 3-carbon structure you will see an ester group present. This is the presence of this ester group is very important. Along with this you will see an amine group, and this amine group is mainly the main functional group in that structure. Okay, is it okay? So this is the structure of tyrosine. Next, citrate synthase inhibitor in TCA cycle. Direct question from the tricarboxylic acid cycle. So what is tricarboxylic acid cycle? It is also called Krebs cycle. In that you will see that succinyl coenzyme A, and that succinyl coenzyme A is the citrate synthase inhibitor. Okay. So see, succinyl coenzyme A. See, this is the Krebs cycle, right? You can easily remember that Krebs cycle by C-cis isoxo alpha ketone. How can you remember that? C-cis isoxo alpha ketone. Succinyl coenzyme, succinate, fumarate, and then malate. Okay, by this way you can remember this one. Simply C-cis isoxo is the right side. That is the main important part. And can you please tell me which step plays the crucial role here in the Krebs cycle? Again, this one. Okay? Succinyl. Can you tell me which one of the following is the main receiver that receives the proton? In that case, the answer will be, where is the correct answer? Yes, this one, acetyl-CoA. Next, Montreal salt. This question is from inorganic chemistry. Montreal salt, you have to remember Montreal salt, you can remember by M for Montreal salt and M for Montreal salt and M for meta. Yes, meta. So sodium metaphosphate. In this, M for meta and M for moderate salt. Again, if sodium bicarbonate, then B for bicarbonate and B for baking soda. So this B for baking soda and M for moderate salt. And what is the structure of baking soda? Sodium bicarbonate. And what is moderate salt structure? Sodium metaphosphate. So NaPO4. Okay. So you can easily remember B for sodium bisulfate and B for baking soda. Again, M for metaphosphate and M for moderate salt. Simply, these types of questions will be asked from inorganic chemistry. Direct questions. Inorganic chemistry, jurisprudence, and cognosy, you will get direct questions. From pharmaceutics, you will get little bit tricky questions also, some direct questions also, but informative questions. From pharmacology, mainly you will get question from classification and what it is called unwanted effect and some contraindications. And when it is about pharmaceutical chemistry, in that you will get some questions from organic chemistry that is mainly based on that I mentioned just few minutes ago. Acid strength, basic strength, acid stability, basic stability. Some questions you will get from mechanism of reactions, and some questions you will get from structure of the drugs, that is chemical structure of the drugs, functional group and something like that. And some questions you will get from the structural activity. Okay. Next, after moderate salt, what is the next question? C, sodium metaphosphate. So you can remember by using M for metaphosphate, M for moderate salt, B for bicarbonate, B for baking soda. Next, heavy kaolin is used in the preparation of, heavy kaolin is used in the preparation of poultice. What is this poultice? Poultice is a layer. Poultice is a layer used on the skin. Okay, and it is hard actually. You know, if a person is having fracture after the treatment or after the what it is called, after treatment or locating that fracture again, there is a wrap used on the skin, you know, that is little bit hard carbonate structures. In the same way, poultice is a layer, hard layer used on the skin after any types of different sepsis or infection or something like that. So heavy kaolin is purified hydrated aluminum silicate. You have to remember here this kaolin from inorganic chemistry. What is this kaolin? Kaolin is aluminum hydrated silicate. So aluminum silicate. You have to remember that name. Okay? Baking soda, moderate salt, kaolin. Kaolin is hydrated aluminum silicate. Okay. And it has high absorbency and retains heat well, making it ideal for poultice preparations. Heavy kaolin. Kaolin poultice applied hot to skin for inflammation, pain, swelling. So I mentioned already, it is used as a layer on the skin. Okay now? And often contains glycerin and methylsalicylate. Light kaolin used in the dusting powder or internal suspensions. So light kaolin is also used in the internal oral suspensions. Okay. Next, M plus at 136, M plus 2 at 138 in 1:1 ratio. Base peak at 77. It will be aromatic ring. Definitely it will be one bromine and aromatic ring will be there. See, in that isotopic pattern, chlorine, it is having 35. What is 35 here? 35 is the atomic mass. 35 is the atomic mass of chlorine and 37 is also atomic mass of the chlorine. Both are isotopes. Okay, but in the case of bromine, 79 is the atomic mass and LR is 81. Now that chlorine is 3:1 ratio, M plus and N plus 2. That M is metal and N plus means only one electron is removed and N plus 2 means two electrons is removed. So when one electron is removed and two electron is removed, it is mentioned as plus and plus 2. And here in the case of bromine, same plus and plus 2. Now this bromine in the ratio 1:1 and chlorine in the ratio 3:1. So data interpretation in that you will see M plus is 136 and M plus 2 is 130 in 1:1 ratio. That means one bromine and base peak at M by Z 77. That means atomic mass upon atomic number ratio equals to 77. So phenyl cation that is C6H5. That means it is aromatic ring. So isotope pattern and presence of two chlorine with aromatic ring. So this is the structure. The structure is like this. Can you please tell me what is this structure? This is benzodiazepine. Just few minutes ago I mentioned that, right? Benzodiazepine, see benzene is connected with the diazepine ring. In that 7th position, chlorine, that is presence of highly electronegative atom is very, very important, okay? So this is the structure here. So how can you identify that? See, the same graph. And can you please tell me which one of the following is the base peak here? The base peak. Base peak means the peak which is having maximum amplitude. So here the base peak is this one, 209. Okay, na? Last question. Modified Gazette test is a limit test for. Modified Gazette test is a limit test for arsenic. Okay, so it is a limit test for arsenic. Up to this, the pharmaceutical chemistry is over. Now, ma'am will come and I think pharmaceutics will be started now. Okay, okay, thank you. So up to this, you have any questions? If you don't understand anything, you ask me. I hope you understand everything. Na? Then you keep studying well, keep revising more. Now don't study new things. I mean learn less new things, but keep revising the old things, whatever you have studied earlier. Revision is more important for now, for this time. Okay, so keep revising more and more. Keep attempting the questions and keep attempting test more. Okay, and all the best.
Yes, sir. Thank you very much for that. And okay. So, how many online? Yes, all of you. Are you online? Shall I continue with the pharmaceutics part? Yes, please respond. Please respond. Can we go with the further part? Pharmaceutics and the remaining questions? Yes. Yes, are we together? Yes, okay, fine. Thank you very much, Piyush Verma. Okay, so we'll go. Just please give me a moment so that I can open my PPT. Okay, I'll be away for a while, just a while. Okay. Fine, thank you. Hope my screen is visible. Yes. Hope my screen is visible. Okay. So we'll go with the pharmaceutics part first. Okay. I'll go a little faster. So as we are delayed by a moment, so yes, we'll go with pharmaceutics first, and we'll go a little faster. Sure. And the first question from emulsions. Okay, the first question from emulsion. In an emulsion, which instability step is prevented by emulsifiers? Okay, in an emulsion, which of the instability step is prevented by emulsifiers? Okay, emulsifiers prevent which of the emulsification instability step? We all know the various instabilities in emulsions. Okay, A, flocculation, B, breaking, C, creaming, and D, coalescence. And D, coalescence. What's the right answer? Yes, please. Please, I need immediate answers in the chat box. Yes, answers in the chat box, please. Quick answers. It was a very simple question. Simple question with instability of emulsions. Yes, okay. And the right answer is D, coalescence. Okay, and the right answer will be D, coalescence. That is, so we all know what about emulsifiers? Okay, emulsifiers, we also know emulsifiers, emulsifying agents, surface active agents or surfactants or surface active agents. Surface active agents. No, the right answer is D, actually. The right answer is D, it is coalescence. Okay, instability is prevented by means of emulsifiers. So emulsifiers are nothing but emulsifying agents or surfactants. We know there are various classes of emulsifying agents or emulsifiers which act by various different types of mechanisms. We know the multimolecular adsorption, monomolecular adsorption, and many kinds of theories that are related to emulsifiers and all. So regarding this, the instability prevented by emulsifiers will be the coalescence. Okay, because flocculation, it is not related to emulsifiers in any way, because flocculation is related to the size of globules. Okay, flocculation will be related to size of globules, and it is not much affected by the emulsifiers. Whereas creaming is due to the density differences. Again, density differences between the particles of the phase, of various phases. Like we have oil phase and water phase. Oil in water emulsion, which we have a continuous phase and we have a discontinuous phase, all these things, right? So it is dependent. Creaming is dependent upon the density differences. And we usually study regarding this, regarding the upward creaming and the downward creaming. Right? We have the upward creaming and downward creaming based on the type of emulsion. Okay. If it is an oil in water emulsion, it will exhibit an upward creaming, whereas the water in oil emulsion will exhibit a downward creaming. Okay, it exhibits a downward creaming. So it is completely based on the density differences between the particles and not on the emulsifiers. Okay, so this we can eliminate option of creaming and breaking. Okay, breaking is not directly related to emulsifiers. Again, it is related to phase separation. It is slightly related, but it is not directly related to the emulsification procedure. Okay, so we can overrule breaking also, whereas coalescence is related to the emulsifiers. So the right answer will be emulsifiers. Okay, so coalescence is about the droplet fusion. So droplet fusion is related to the quantity and the type of emulsifiers that are used in that particular emulsion. Okay, all of you? Yes, please post your answers and questions and answers, both of them in the chat box. Yes, please post in the chat box. Please stay active. Please, this is the last moment, so you need to stay active at this moment. Okay, we'll move to the next question. Okay, select the correct statement regarding the Schulz-Hardy rule. Okay, correct statement regarding the Schultz-Hardy rule. Very, very important. These kind of questions are very important especially in pharmaceutics. Okay, especially in pharmaceutics, these are the most probable questions, especially with respect to physical pharmaceutics, with respect to pharmaceutical engineering, with respect to pharmaceutical technology. These kinds of questions, like in the statement-based questions and the questions related to assertion, reasoning, statements, and identify the correct statement. These kind of questions these are the most probable type of questions you are going to get. Okay, these are the most probable types of questions that you are going to get in your examination. So please be attentive and be practical with these type of questions. Try to analyze the question. First, what you have to do is try to decode the statements. Okay, decode the statements and then go for answering. Go for answering the question. Don't be in a hurry, like I have to answer this question at the earliest. No, there is no hurry. You have 36 minutes for 25 questions. You have 36 minutes for 25 questions. Approximately each question you can answer in approximately 1 minute, 1 minute 30 seconds. You can take approximately 1 minute 30 seconds for a question. So please don't be in a hurry. Okay, this is the primary takeaway I can say. Okay, and the question, coming back to the question, the statement regarding the Schultz-Hardy rule. Schultz-Hardy rule: the precipitating power of an ion on a dispersed phase of opposite charge increases with the increase in valency. The higher the valency of the effective ion, the greater the precipitating power. This is the basic principle of the Schultz-Hardy rule. Okay, this is the basic principle of Schultz-Hardy rule. That is, it is the precipitation or the coagulation ability and the precipitation power of the precipitation power in a colloidal system. These Schultz-Hardy rules are related to colloidal systems actually. Okay, this Schultz-Hardy rule we study in the colloidal system. So what is the basic principle of Schultz-Hardy rule? It states that the coagulation between the molecules, the association, coagulation, and the precipitating power of molecules, it is dependent upon the valency of the effective ion. It is directly proportional to the valency of the effective ion or the electrolyte. Okay. So, and the cations, based on the cations, the capacity, the precipitating power is aluminium greater than barium greater than sodium, and anions, ferrocyanate is greater than sulfate greater than chloride. Okay, so we will see which of these statements is correct. Okay, so we have various options, and which of the statements is correct? Yes, all the statements are correct here. Okay, that means the precipitating power of an ion increases with the increase in valency. Increase here we can see increases with increase in the valence. The valence of ion aluminium is 3. The valence of barium is 2, and whereas the valence of sodium is 1. Okay, that means the precipitating power is increasing with increase in the valency of the respective ion. Okay, whether it may be an anion or a cation, it increases with increase in the valency. Please remember, very, 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 very important, these kind of questions, the Schultz-Hardy rule and Stokes-Einstein's equation, these kind of questions, these are, and Stokes equation, Nernst equation, okay, and all these Noyce-Whitney's equation, all the Fick's law, these kind of equations and these kind of laws and questions related to these kind of equations are very important in your GPAT examinations. You will get approximately 2 to 3 questions from these kind of equation-based questions. Okay. So, and the right answer is yes, all are correct. Okay, all the options are correct. Next, DLAO theory explains that the interparticular attractions between. So, I'm not taking a lot of time. I'm not explaining each of them in detail because you all know these very well. So, wherever it is necessary, I would like to stress. Okay. Okay, all of you, please respond. Any one of you. I did not get any response. I'm getting only less responses so far. Please respond. Whoever are online, please respond. Something or the other. I hope like these things are clear, like the board and the basic things. Yes. Okay. Fine. DLAO theory explains that the interparticular attractions between colloidal particles are as a result of interparticular attractions are based on the reaction. Yes, van der Waals attractions. Very good. Whoever have answered this question, yes, that it is a result of van der Waals attractions. That is the statement of DLVO theory. DLVO theory, as explained by Derjan, Landau, Verby, and Obeek, it is what is it about? It is about the colloidal stability. That means the stability of based on these emulsions, suspensions, and all these things. The colloidal. So the based on the colloidal particles, what is the stability? So how DLVO theory, it explains about the electrical double layer. Okay, and we have the various potential differences. We have the study of the various potential differences. So and the electrostatic repulsions, van der Waals attractions. Okay, all these things. So here, what are they talking about? The van der Waals attractions. Okay, so it is about the van der Waals attractions. Interparticular attractions are a result of van der Waals attractions. Okay. Yeah, next question. The polymorph which can be changed from, very important question once again, question from pre-formulation. Okay, the polymorph which can be changed from one form to another by varying temperature or pressure is called. Okay, the question from polymorphism. The polymorphs which can be changed from one form to another by varying the temperature or pressure are called. Yes, are called amorphous amorphous, that means no polymorphism, amorphous type, crystal type, enantiotropic polymers, or monotropic polymers. What's the right answer? Right answer? Yes, very good. Yes, which can be changed from one form to another form based on the temperature and pressure are known as enantiotropic polymers. Enantiotropic polymers. Whereas monotropic polymers, they are irreversible, and enantiotropic polymers are reversible. Okay, monotropic polymers are irreversible, whereas the enantiotropic polymers are reversible. Okay, they can be changed by these temperature and pressure changes. Okay. So usually in an energy diagram of a polymorph, in an energy diagram of an energy of an enantiotropic polymer, we get a two form. Okay, we get a two form diagram. Okay, this is very, very important. Yeah, and questions, we'll see some questions from the dosage forms. The density of an aerosol system may be accurately determined through the use of. Okay, so don't just go with a blind assumptions question from aerosol. So don't always go with the blind assumptions that, okay, so when we are studying aerosols, okay, we need to only study about the particle size of aerosols and the propellant nomenclature and the quality control test of aerosol valves. No, okay, so most of us do this. Okay, most of the people do this. And there are certain questions which are definitely related to other factors also. Okay, the density of an aerosol system may be accurately determined through the use of a hydrometer, a picanometer, or the test gauzes. What's the right answer for this question? Aerosol system density. Density can be determined by, see, this is a question from quality control of aerosols itself. But in quality control, we usually go for the valve testing, okay, rather than density, right? Yes, density is determined through a hydrometer and a picanometer. Okay, the density is determined by means of hydrometer and picanometer and not by means of test gauze. Okay, so this test gauze is what they are doing. Test gauze is nothing but the pressure testing gauzes. We usually test the pressure. Okay, so test gauze here. Test gauze refers to the testing of pressure, not the density. Okay, so please read the question completely in these type of questions, in these cases. See, very, 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 very important. All these three are used in aerosol systems. All of these are used in the estimation and determination of these aerosol systems. But what happens? Where comes the difference? Here you have to identify what is it. Okay, here the density, they are calling it a density, is determined by the use of. Okay, if we are not concentrating on density, yes, we will get less denser. Okay, our density will fall down. Okay, what happens when we are less denser? We will float, right? Okay, so hydrometer and picanometer are used to measure the density, whereas test gauzes are used to measure the pressure. In case of aerosol valves. Okay, this is about the valve pressure, and this is about the density. Okay, density of the fluid or density of the formulation or density of the propellant, whatever it is. Next question, match the tablet formulation. Very important and simple and important. Okay, simple and important. Match the tablet formulation ingredients with their examples. Please respond, whoever are online, please respond. Okay, match the tablet formulation ingredients with their examples. Okay, so ingredients we have are glidants, binders, disintegrants and lubricants, whereas the examples we have are povidone, stearic acid, calcium silicate and ethyl cellulose. Okay, I would like to make a small correction to this question actually. Not to the answer, I need to make a small correction to the, so there was a little typo error. Actually, this is not a disintegrant. Okay, here it should not be a disintegrant. In fact, it is a diluent. Okay, in fact, this part should be a diluent, not a disintegrant. Okay, so okay, maybe we can consider this. Okay, and coming to the glidant part. Yes, anyone can answer glidant? Which of these is a glidant? Glidant? Ethyl cellulose can't be a glidant. What is a glidant in this? Glidant silicates. Okay, we always discuss silicates, silicon dioxide, silicate, when anything related to colloidal silica. Okay, a glidant is calcium silicate, magnesium silicate, and silicon dioxide, also known as colloidal silica, magnesium silicate, zinc silicate. Okay, so all these things, calcium silicate, silicates are glidants. Silicates are glidants. Whereas binder among these very important questions from tablet excipients, you will get at least minimum three questions from some kind of tablet excipients in some way or the other. 2 to 3 questions from tablet excipients. Like all over the pharmaceutical excipients, co-processed excipients and formulation ingredients, especially in parenterals and ophthalmic preparations. Yes, very good. Very good, Dashrad. Binder is povidone. Okay, povidone is a liquid binder. Povidone, we usually discuss povidone is an example of a liquid binder. It is a liquid binder, okay, which does not need any preparation. Then it's a liquid binder. Whereas diluent or disintegrant, okay, so it is not a disintegrant, it will be diluent. So diluent among these, so we only have still 2. We have only 2. Diluent among these is ethyl cellulose. We can, okay, ethyl cellulose, it can be non-aqueous diluent. Ethyl cellulose, it is a type of non-aqueous diluent. It is mostly used as a release retarder actually. Ethyl cellulose, it is used as a release retarding agent or a coating agent. Okay, or a coating agent. But it can be used as a diluent also. It is a non-aqueous diluent. Whereas coming to lactose, mannitol and all these things, we have so many kinds of starch. All these things are aqueous diluents, whereas ethyl cellulose can be a part of non-aqueous diluents. Okay, and a lubricant, yes, the standard example of a lubricant will be a stearic acid, stearic acid, stearates, magnesium stearate, zinc stearate, all these kinds of things. We have lubricants, they are stearates or stearic acid. Okay, so this is so what do we have here? What is the right option? Yes, what is the right option is D. Okay, the right option is how much percentage of tablets concept covers in pharmaceutics part in GPAT? Okay, yeah, only from tablets. Only from tablets you may get around 2 to 3 questions. That's what I was just mentioning. 2 to 3 questions from tablets, kind of, especially in tablets regarding to the formulation of tablets. Yeah, formulation of tablets, that means formulation and formulation excipients together. Okay, together formulation and formulation excipients and evaluation of tablets and also the defects in tablets. Approximately from total tablets, we may expect 2 to 3 questions. May not be direct questions. Some way or the other, we will have 2 to 3 questions, especially with respect to co-processed excipients. Please be clear with the co-processed excipients. I'm repeating so many times. Okay, if possible, I'll try to share a chart of co-processed excipients in respective groups also, whoever have joined the group. And I'll also try to share the WhatsApp group link for any information and any last tips and last minute information, so that all of you can join the WhatsApp group, whoever is not present. Okay, so that I'll try to share. Co-processed excipients are also very important. They form a very important part of this pharmaceutics, especially this tablet part. Okay. Yes. And so the right answer is glidants. We also know they improve the powder flow by glidants. By reducing the glidants, what do they reduce? Which type of forces? Glidants, they reduce which type of forces? Cohesive forces or adhesive forces? Glidants, they reduce which type of forces? Glidants. What are they are the type of frictional, anti-frictional agents they reduce, and glidants reduce what? Reduce cohesive forces. Okay, glidants reduce the cohesive forces between the particles, whereas yes, lubricants, they reduce the adhesive forces between the particles. Okay, and coming to binders, yes, we all know very well about the binder, right? Binders and starch, especially starch. Starch is the most widely used binder, whereas povidone and all these things, they are used as liquid binders, direct binders. And disintegrants, which facilitate the breakup. Okay, disintegrant, usually ethyl cellulose is not used as a disintegrant. Okay, just it was mentioned, but it is not used as a disintegrating agent. It is a diluent. Okay, it was a mistake in the question, not with the answer. Okay, and lubricants, yes, stearic acid, right? Next question, the hardness, very important once again important question. The hardness ratio of, see, this question was repeated twice or thrice in the GPAT examination, in earlier GPAT examinations. This question was repeated twice or thrice actually. Okay, so this may be asked, okay, it will be, sometimes it will be reversed also, I will just explain. Hardness ratio of dry glycerin to dry gelatin in a soft gelatin capsule. In a soft gelatin capsule, please read the question completely. With respect to this kind of questions, read the question completely. The question is about the dry glycerin to gelatin. Okay, the ratio between glycerin to gelatin. Okay, please observe whether the question is about glycerin to gelatin or gelatin to glycerin. Okay, this part we have to concentrate, whether the question is about glycerin to gelatin or gelatin to glycerin. This part we have to concentrate a lot. And the next concentrating part, see, these are some kind of we have to mark. Okay, some parts we have to mark in these questions. Okay, it is about the soft gelatin capsule and it is about the soft gelatin capsule they are asking. Okay, so there is a difference. So what is it? 0.8 to 1, 0.4 to 1, 0.6 to 1 and 1 on 1. What is the right answer? Ratio of dry glycerin to dry gelatin in a soft gelatin capsule. What is the right answer? Yes, what is the right answer it is? Yes, it is 0.4 on 1. Okay. Yes, so what it does actually? Glycerin, when it is used in this, so glycerin when it is used in this soft gelatin capsules, what it does, it has to increase the permeability, it will increase the flexibility. Glycerin when it is used in capsules, it will increase the flexibility and it prevents the brittleness. Okay, it prevents the brittleness. I think no. This is 0.8 to 1 actually. Okay, it is not 0.4 on 1, it is 0.8 on 1. In soft gelatin capsules, please remember, so the answer is mentioned wrong. In soft gelatin capsules, it is 0.8 on 1, not 0.4 on 1. 0.4 on 1 for hard gelatin capsules and 0.8 on 1 for soft gelatin capsules. I think I was not observing this. Oh my god. Oh my goodness, I'm sorry about this. Okay. So the right answer is 0.8 on 1, not 0.4 on 1. 0.8 on 1 for soft gelatin, 0.4 on 1 for hard gelatin. Because hard gelatin capsules, they do not need so much of flexibility. Soft gelatin capsule need more flexibility. So there is a higher ratio of gelatin in soft gelatin capsules than the hard gelatin capsules. Okay, it is not 1 by 1. The ratio of gelatin is always 1. Okay, the ratio of gelatin is always 1. Gelatin ratio will always be 1, but the glycerin ratio will change. If it is hard gelatin, it is 0.4. If it is a normal, intermittent, there are certain intermittent type of capsules also. If it is an intermittent type of capsule, it will be 0.6. And if it is a soft gelatin capsule, it will be 0.8. The ratio of glycerin. Okay. Okay, ratio of glycerin increases with increases the softness of the capsule. Okay, very, very important. Next. Yeah, definitely. Okay, definitely. We will discuss this. Okay, at the end of the session, we can discuss this even. Definitely, you can. Okay, you can. If you are focusing on limited elements, definitely, we are here to help you. Even okay, you can contact us at any time. Anytime. Okay, we are here to support you and help you. Any of you, all of you, and any of you. Okay. Next, the equipment used for size reduction of fragile materials is. Important question again from pharmaceutical engineering. Question from pharmaceutical engineering. The equipment used for the size reduction of fragile materials is ball mill, B fluid energy mill, C hammer mill, and D rotary mill. What's the right answer for this question? Fragile materials. Size reduction of fragile materials. What is the right answer? Right answer? Please. Yes, for fragile material, it is fluid energy mill. Okay, the right answer is fluid energy mill. Okay, because fluid energy mill here, it does not involve any hard particle collisions. Okay, it does not. It uses only gas streaming. Okay, it uses only gas streaming. For the particle collisions, it uses only gas streaming. It does not involve any kind of heat generation, any kind of attrition or impact. Okay, in fluid energy mill, no kind of impact or attrition types of principles are not involved in fluid energy mill. It only involves the collisions between the particles. Okay, so that is the reason for fragile. Because for fragile particles, what happens if there is impact or attrition? What happens? First of all, they are fragile. So, okay, basically they are fragile. So what happens? Immediately there is like size reduction. It is non-uniform. It leads to a non-uniform size reduction. That is the reason fluid energy mill will be the right answer for fragile. See, for fragile for fluid energy mill. Please remember, fluid energy for fragile particles. Okay, and ball mill. So we will see the other options also. Ball mill is suitable for hard and crystalline substances. So ball mill, it usually uses the principle of impact and attrition. This is also very important. So we will get at least one question is very much important and very much guaranteed. Most of the times it is guaranteed from either the principles of size reduction or the applications of size reduction. Okay, either from either of the parts, one question is minimum. Okay, so the ball mill uses the principle of impact and attrition, whereas fluid energy mill just now gas collisions which are associated or which are attributed by gas. Okay, suitable for fragile and heat sensitive materials. Hammer mill, as we all know, the principle is impact and it is suitable for brittle and fibrous materials. See, whenever you are coming across the term fibrous material or a hard brittle material, then immediately go with the hammer mill. Okay, and the rotary cutter mill, especially we are using this cutter mill for natural substances. Okay, if we are using crude drugs. Okay, the size reduction of crude drugs can be done by using. Okay, which of the following mills can be used in the size reduction of crude drugs or crude drug materials? What will be the right answer in that case? In that case, it will be rotary cutter mill. Okay, because it is using cutting. It is using the action of cutting. Okay, next question we have is the diffusive mixing. Question from mixing, pharmaceutical engineering once again. Diffusive mixing is also known as micro mixing, macro mixing, shear mixing, and all of the above. ये तो हैदराबाद से इस लाइव तो हैदराबाद से. Okay, so we will answer your further questions too. Diffusive mixing is also known as micro mixing, macro mixing, shear mixing, and all of the above. Yes, diffusive mixing. This was a direct question. Diffusive is micro mixing. Okay, Okay, diffusive mixing refers to micro mixing. Diffusive. Okay, the name itself indicates diffusive means so each particle will diffuse into the other particle. Okay, the mixing is accomplished by means of, see, there are a mixture of particles. So each particle is interacting with the other particle. Each particle will diffuse into the other particle. It diffuses into the other particles. So this is known as micro level mixing. Diffusive mixing is micro level mixing, whereas the macro mixing is the convective mixing. Okay, macro mixing is the convective mixing. We have one more type of mixing, that is macro mixing. That means a bulk of the particles are interacting with one more bulk of the particles. You are not sure which particle, whether each of the particle is interacting with another particle or not. Okay, we are not bothered. This is the macro type of mix. Convection. Convective flow means bulk flow. Convection is nothing but bulk. Okay, wherever you are coming across the term convection, it refers to bulk movement or bulk transfer. Convection is nothing but bulk movement or bulk transfer. Please remember. So here bulk is about if you get a question about convective mixing is, so bulk mixing is macro mixing. Okay, it is not micro level, it is a macro level mixing. Okay, so this was the right answer is micro mixing. Diffusive mixing will be a micro mixing. And the next question we have, yes, just now I was telling you, there are very, very important questions from formulation excipients, not only tablets, in pharmaceutical formulations. Okay, pharmaceutical formulations में ये tablet and excipients, especially formulation excipients related questions are very, very probable. Okay, especially the statement related questions, match the following related questions. You may not get a direct question, but mostly statement and match the following related questions. Okay, read the following statements about diluents and identify the correct ones. Okay, lactose, we will see one on one. Okay, we shall see one on one. Lactose undergoes Maillard reaction with primary amines. Lactose, it undergoes Maillard reaction with primary amines. Is it right statement? Dicalcium phosphate is water soluble. Okay, they asked us only to identify the correct statements only. Mannitol produces a cooling sensation in mouth, and microcrystalline cellulose shows plastic deformation. So what will be the right answer for this question? Yes, 1, 3 and 4. Yes, right answer is 1, 3 and 4. Yes, lactose, it undergoes Maillard reaction. Lactose, it undergoes Maillard reaction with primary amines. Yes, we have discussed. We know this is the major drawback of lactose. Hence, lactose is usually substituted. Okay, usually lactose, what happens with lactose? Lactose is usually substituted with anhydrous lactose. Here. Lactose, it undergoes Maillard reaction when it is reacting with primary amines. Okay, when it is reacting with the when the drugs are primary amines, it is not about the drug excipient interaction. It's a kind of drug excipient interaction. So what happens when it is in that case? So we are going with anhydrous lactose. Okay, in the presence of water, Maillard reaction, the lactose reacts with primary amines in presence of water actually. Okay, lactose, it absorbs water and the reaction goes on. It's a kind of hydrolysis reaction. So absence of water, anhydrous lactose can lead to the overcoming of this Maillard reaction, or Maillard or Millard reaction. Anything is one and the same. Okay, it may be Millard reaction or it may be Maillard reaction. Anything is same in fact, same actually. Okay, next we have dicalcium phosphate is water soluble. No, absolutely wrong. Dicalcium phosphate is an inorganic diluent. One of the classic examples of inorganic diluents. Classic example of hydrophobic diluent and an inorganic diluent is dicalcium phosphate. Okay, please remember, all of you whoever is noting down this, please note down dicalcium phosphate is an inorganic and a hydrophobic diluent. So it is not a water soluble diluent. Mannitol produces a cooling sensation in the mouth. Yes, definitely. Mannitol has a property of, it exhibits a property of negative heat of solution. Okay, it exhibits or it has a property, mannitol has a property of negative heat of solution. Due to this negative heat of solution, it produces cooling sensation in mouth. This is the reason mannitol is the main ingredient in most of the chewable tablets. This is the reason mostly mannitol is used as a primary ingredient, and it is one of the most common ingredients used in the chewable tablets. Okay, because of this cooling sensation that it produces in the mouth. And microcrystalline cellulose, yes, it shows plastic deformation. Microcrystalline cellulose, it shows plastic deformation. It is the property of this microcrystalline cellulose. What is the microcrystalline cellulose? We should know some very, very important points about microcrystalline cellulose. So what is the common or brand name of microcrystalline cellulose? It is marketed under the brand name of microcrystalline cellulose, usually marketed under the brand name of Avicel. Okay, microcrystalline cellulose, it is usually marketed or it is usually branded under the name Avicel. Okay, it is used under the name Avicel. Okay, and it has two grades. In fact, microcrystalline cellulose, it has two grades: Avicel pH 101 and Avicel pH 102. pH 101 and pH 102. Whereas this pH 101, it is in the form of a powder. The basic difference is pH 101 is in a powder form and pH 102 is in a granular form. Okay, it is obtained in the form of granules, whereas pH 101 exists in the form of powders. Okay, this is the basic and major difference of information about microcrystalline cellulose. Microcrystalline cellulose, it is a very widely used excipient. It can be used as a diluent. It is used as a disintegrant. It is used as a disintegrant, especially it is a super disintegrant. Microcrystalline cellulose, it is a super disintegrant. It is a diluent. It is a disintegrant. It is a pore former. Okay, it is a pore former. It has so many applications, microcrystalline cellulose. And it is a directly processed excipient. Okay, direct compressible excipient. So many advantages and uses with that of MCC. Okay, so just now we have discussed about all these things. Yes. And we will see some questions from pharmacokinetics and biopharmaceutics and pharmacokinetics. We will see one on one. The next we have the molecular weight of alpha-1 acid glycoprotein is. Okay, the molecular weight of alpha-1 acid glycoprotein is. What is the molecular weight of alpha-1 acid glycoprotein? Yes, this was the direct question. It is 44,000. The molecular weight of alpha-1 acid glycoprotein is 44,000. Okay, alpha acid glycoprotein, also known as orozomucoid. This alpha acid glycoprotein, it is also known as, the other name for alpha acid glycoprotein is orozomucoid. Okay, so it is a type of protein. It is a type of plasma protein. Alpha acid glycoprotein is at AAG. Okay, usually called as AAG. It is necessary and it is useful for the binding of basic drugs. Okay, it is useful for the name alpha acid. Okay, alpha acid glycoprotein. So acid will bind base. Please remember that this acid will bind a base. Okay, there is, so see this interaction, the plasma protein binding is also, it is nothing but a kind of interaction between a drug and a receptor, drug and a protein, or a drug and a receptor, whatever it is. It is also a kind of chemical interaction, right? So this is a kind of acid-base interaction. Okay, alpha acid glycoprotein will bind basic drugs, whereas albumin will bind most of the acidic drugs. Albumin binds most of the acidic drugs. Okay, and albumin, it binds most of the drugs. Almost 90% of the drugs are bound to albumin, because albumin is the largest plasma protein with 66,500 Dalton molecular weight and how many binding sites? And how many binding sites are there in albumin? Yes, this is also very important examination point of view. Very, very important. How many binding sites are present in albumin? 4. It's not 44. It's 4. Very nice, Sarthak. Yes, 4 binding sites. Albumin, it consists of 4 binding sites, like diazepam binding sites, alpha-propozone binding site. Okay, like this, there are like barbiturates binding site. Like there are 4 binding sites, 4 kinds of binding sites on albumin. Okay, so it is the largest binding protein, largest plasma protein. Okay, The compound used as a marker to measure erythrocytes' physiological fluid compartment. Okay, this is about the fluid compartments and their measuring volume and the volume. Okay, so but the compound that is used as the indicator marker. Okay, especially the markers to measure the erythrocytes. To measure erythrocytes, it is chromium 51, deuterium oxide, ethocyanin green, and Evans blue. And Evans blue, which is the right answer for this question? Yes, very nice. Very nice. Chromium 51. Okay. Chromium 51, it measures the erythrocytes. Okay, this is usually about the volume. Okay, volume of distribution. And this volume, this total body volume, it is divided into various types. Okay, this total body volume, it is of like total body water. Okay, we have different types of water. We can call it erythrocyte volume, separate total body water volume, and also plasma volume. Okay, all these things, there are different types of volumes. Okay, and erythrocyte volume, that is especially RBC volume or erythrocyte volume, is the marker to measure it is chromium 51. Okay, because chromium binds irreversibility to hemoglobin. How do we measure these actually? How do we measure these volumes? Because of their binding. Okay, we measure this because of their binding. Because these go and they bind. So how much amount of the drug we have given and how much is the binding that has been observed? Okay, how much is the binding that has been observed? So this chromium, it binds to hemoglobin. That is the reason chromium is used as a marker to determine the erythrocyte volume and the total body water. Very, very important again. Total body water is established by deuterium oxide, because deuterium oxide, it is an isotope of water. Deuterium is an isotope of hydrogen. Okay, deuterium is an isotope of hydrogen. That's all. H2O is water. D2O is deuterium oxide. Deuterated water. It is known as deuterated water. It is a type of isotope of hydrogen. Okay, next we have indocyanin green, which measures the plasma. Indocyanin green and Evans blue, which measures plasma volumes. Okay. So we will just move forward. Distribution of a drug. A question related to drug distribution. Distribution of a drug from systemic circulation to extravascular tissues involves what? The permeation of free or unbound drug through capillary wall into extracellular fluid. Yes. Distribution causes irreversible loss of the drug from the body. Permeation of drug from extracellular fluid to intracellular fluid is applicable. Distribution involves reversible transfer between blood and tissues. Which of these statements is not correct? Okay, which of these statements is not correct? So what are these? Okay, all statements are correct. P, R and S are correct, whereas Q is incorrect. Only R is correct. P, Q are correct, R are correct, and whereas S is incorrect. Which is the right option? What's the right option regarding distribution of drugs? Distribution of drugs. Right option is? Yes? Option A. No. Option A is the right answer because Q is incorrect. Q is incorrect. What we are saying? Distribution causes irreversible loss of drug from the body. No. Distribution, the term itself, it mentions it is a reversible transfer. Okay. That is the definition, the very definition of distribution. It states that it is a reversible transfer of the drug between plasma and tissues. Okay. Between the blood and tissues, blood compartment. Yes, of course, definitely. Distribution is reversible. Distribution is reversible. Of course, it is reversible. Okay. So it is a reversible transfer of the drug between plasma and tissues and body tissues is known as distribution, the very definition itself. Okay. So that is the reason Q is wrong here. All the remaining are true. Yes. Unbound drug, it transfers from capillary wall to the extracellular fluid is absolutely right. And the drug transfers from extracellular fluid to the intracellular fluid is correct. And distribution, it involves the reversible transfer between blood and tissues. Correct. Okay, so here we can see it is the reversible transfer. See, here we can see it is reversible reaction. Okay, next. The extraction procedure, question from dispensing pharmacy. Okay, a question from dispensing pharmacy. The extraction procedure involving an evaporation step for complete removal of water or moisture to obtain a semi-solid product. To obtain a semi-solid product, here we have to identify the marker statements. Okay, here we have to identify the prime and the marker statements. So what we are evaporation step, the extraction procedure which is involving an evaporation step, yes, and complete removal of water to obtain a semi-solid product. Okay, there are 3 marker statements in this particular question. Okay, in this question there are 3 marker statements. Okay. So what is the like oxalation, triple maceration, modified percolation and reserved percolation? Which is the right answer for this? What is the right answer? Oxalation is nothing but hot percolation. Okay, so oxalation is nothing but hot percolation. It also involves an evaporation step, but the obtained product is not completely free of moisture. It is not completely free of moisture. Okay, here hot percolation is also used for liquid products also. The obtained product, it may be a liquid extract also. Okay, coming to triple maceration. In triple maceration step, evaporation step is not available. In triple maceration, evaporation step is not available. So immediately you have to see, as soon as you see this step of evaporation step, as soon as we see evaporation step, what we have to do? First we have to eliminate this triple maceration. Okay, elimination method, very important. We have to follow. Okay, first what we have to do? We have to eliminate this triple maceration, and next to be eliminated is hot percolation or oxalation. Oxalation, because the complete oxalation, through oxalation we also can get liquid extracts. Okay, next is only we have modified and reserved percolation. Yes, so complete removal of water. It is talking about the complete removal of moisture. So it is reserved percolation, reserved for removal of water. It is a reserved percolation. Okay, so usually what happens after normal percolation, after performing normal percolation, this percolation is collected in fractions. What is the procedure of reserved percolation? It is collected in fractions, and then the remaining percolate means the fluid part of the percolate is evaporated. Slowly the fluid part of the percolate is evaporated, and this residue is dissolved, in a reserved portion. Okay, and next question we have is, question from pharmaceutical dispensing part, calculations. Pharmaceutical calculations, yes. You will get around 2 to 3 questions from pharmaceutical calculations. Okay, you can expect 2 to 3 questions from pharmaceutical calculations, especially from pharmacokinetics part, 1 or 2 from pharmacokinetics, and 1 or 2 from the dispensing calculations. Okay, and we have the question. Okay, here we have the question. Calculate the volume of 95% alcohol and water required to produce 600 ml of 70% alcohol. 600 ml of 70% alcohol. Okay, so what is the method that we have to follow here? Yes, what is the method that we have to follow here? The method to be followed here is nothing but, yes, but to solve this question, what method we have to follow? Alligation method. Okay, here we have to go for the alligation method. Alligation method. Okay, so in alligation method, what is the formula for alligation method? Okay, higher strength, lower strength and the required strength. Okay, higher strength and the lower strength and the required strength. Okay, so when they are overlapped, how we have to calculate is, so we have to calculate as higher strength minus required strength. The number of parts of higher strength will be higher strength minus required strength, and the number of parts of lower strength will be required strength minus lower strength. Okay, so based on this formula, yes, we will go through, we will see. So what is the higher strength here? Higher strength is 95. Higher strength of alcohol is 95, and lower strength of alcohol here is 0, water. Okay, so whenever you are told what is the question here is 95% alcohol and water. So water is nothing but 0% alcohol. Water is nothing but 0% alcohol. Required to produce 70% alcohol. So going for alligation method now, 95 minus 70 will be Yes? 95 minus 70 will be 25. 70 minus 0 will be 70 again. Okay, 70 minus 0 will be 70. So the proportions are 25 is to 70. Okay, the proportions used are 25 is to 70. So what's the right answer? Yes? Right answer is yes. If we are calculating, we get. Chalo, if we are going on calculating this, we get yes. 442.1 ml of 95% alcohol and 157.9 ml of water. And 157.9 ml of water is B. Many of them told the right answer. Yes, many of them gave the right answer. B is the right answer. Next, match the structural parameters of vesicles with their size range. Structural parameters with their size range of the vesicles, especially this is related to vesicular systems, liposomes. The vesicular systems, especially liposomes. Okay, we have so many types of liposomes based on the types of vesicles, multilamellar vesicles, unilamellar vesicles. Okay, vesicular transport systems, especially liposomes. We have different types of oligolamellar vesicles. So based on the number of vesicles present and based on their arrangement, there are different types. Okay, so structural parameters and with their, if we are matching, yes, the right answer will be yes. DP2, Q3, R1 and S4 unilamellar vesicles they have. Okay, small unilamellar vesicles they have a size range of 20 to 100 nanometers. Large unilamellar LUVs. Okay, LUVs large. Okay, they have greater than 100 nanometers, and oligolamellar vesicles they have in microns. Oligolamellar, multilamellar. Oligolamellar is different types of lamellae. They have different types of lamellae, 0.1 to 1 microns, and multilamellar vesicles with greater than 0.5 micron diameter. Size ranges. Okay. Next question also from NDDS. Novel drug delivery systems question from novel drug delivery systems. I'm going a little faster because we are already we have so much to discuss further. Okay. Hard contact lenses are usually made from polymethyl methacrylate, hydroxyethyl methacrylate, polypropylene, and all of the above. Hard contact lenses. What's the right answer? It is polymethyl methacrylate. Very important. This is a repeated question. Actually, this is a repeated question in previous papers also. Okay, question from ocular delivery systems. Ocular drug delivery systems. In ocular drug delivery systems, we have ocucerts. Okay, contact lenses, ocucerts, like this. There are various types of ocular delivery systems. Out of that, there are in contact lenses, there are of two types: hard contact lenses and soft contact lenses. Again, okay, contact lenses again there are of two types: hard contact lenses and soft contact lenses. The hard contact lenses, they are made up of PMMA. Okay, PMMA, nothing but polymethyl methacrylate. And soft contact lenses are made of hydroxyethyl methacrylate. Okay, and soft contact lenses are made of hydroxyethyl methacrylate. Okay, so this is very important. Whenever you see the term hard contact lens, you have to remember PMMA. It is a very very important question, and it is very prominent question in most of the examinations. Okay, because the soft contact lenses, they are usually associated with the sustained release type. Okay, soft contact lenses, they are usually associated with sustained release types. Okay, next, again very important, from capsules. Again very important question. So most of the questions here we have presented, are more kinds of repeated and more kind of prominent questions. Okay, if you are if you have scored well in this part, yes, so that this brings you very near to your final examination. Okay, this score, it brings you very near to your final examinations. It's like a quick check. Okay, like a quick check. Okay, so match the capsule filling machine with its principle: Eli Lilly, Pharmatic, Zanassi, and Hofliger and Kalk. Okay, Hofliger and Kalk. And the principles we have are Auger-fill principle, dosing disc or tamping disc principle, dosator. Okay, dosing disc principle is also known as the dosator technique. This dosing disc technique. Usually, sometimes it will be replaced by the term dosator technique. Okay, dosing disc technique or dosator technique, both are one and the same. Okay, and we have the vacuum filling and we have the intermittent compression. Okay, so what is the right combination? Right combination? Yes, this is something you have to learn. Okay, this is something you have to learn. Yes, Eli Lilly with auger fill. Okay, Eli Lilly we have auger fill. Okay, so Lil fill. L with fill. Okay, you just remember L with fill. Okay, Eli Lilly with auger fill and Pharmatic with vacuum. Okay, Pharmatic FV. Okay, Pharmatic machine. It runs with a vacuum fill principle. And Zenasi ZI. Okay, so ZI it is usually okay Zenzi like. Okay, it is a Zeni. Okay, Zenasi with Zeni. Okay, intermittent compression, very important. Zenasi it has a principle of intermittent compression. And Hofliger Carb, HT. Please remember, if you are not thorough with all these things, okay, so you don't need to remember all of them. So, quick tip here is, especially in answering this match the following type of questions, I will also discuss some of them further. Whenever you are answering this match the following types of questions or statement related questions or match the following type of questions, you will have to follow a small trick here. Okay, because the questions will be lengthy, you will run short of time and you will panic. Okay, you will answer only some questions at the end of some time and your timer will be running there. So what happens? This lands us in panicking situation. Okay, so we have to follow a little tricks. Okay, don't go with each and every option. Don't go on answering each and every option. Here we have this question we will see Eli Lilly with Eli Lilly has the auger fill principle, right? So 1 is for P. Okay, 1 is for P. In how many options do we have? We have 1 for P in only 2 options. Okay, you remember only few. If you don't remember some, you remember only few. Okay, Eli Lilly with auger fill. So 1P is only 2 options. So you eliminate A and B. You don't worry about A and B now. Now leave A and B. Okay, and what all we have? What are the differences we have here? Okay, 2 is R. Okay, Pharmatic. Okay, so what we have? Pharmatic is for vacuum fill. And I also told Hofliger and Carb for D, HD. Okay, dosing this. Hofliger Carb for dosing this. Means 4 for Q. 4 for Q. Only one option. Okay, we have only one option which is expressing Eli Lilly with auger fill and Hofliger HD. I told you, right? E fill. L for fill. L for auger, that is fill. L for auger fill. And Hofliger HD. Hofliger for dosing. Okay, remember only these two. If you are not thorough with all these things, okay, remember only few. So you have only one option which is exhibiting these options. That's all, go with that option. Okay, that's all, you can go with that option blindly. Okay. So don't try to waste time on so many things. Okay, I just wanted to give this quick tip. Okay, next. Find the displacement value, a very important once again. Displacement value of phenobarbital sodium in 6 suppositories, each containing 60 mg of drug. The total weight of suppositories, that is 12 grams. Okay, that means the mold capacity is 2 grams. If the mold capacity is 2 grams, then the total weight of the suppositories, that means 6 suppositories will weigh around 12 grams. Okay, so find out the displacement value. Important question again. Once again, just I was telling. Okay, so what is the formula? What is the formula for determination of displacement value of suppositories? Yes, displacement value equals to D by A minus C. Okay, this is the formula. Displacement value equals to D by A minus C. So what do we have as A here? Okay, as A, yes, the total number of suppositories. The number of suppositories is 6 and drug per each suppository. Drug per each suppository is 60 mg. The drug per each suppository it will be 60 mg. but we have to calculate it in grams. Okay, because the suppository mold, the weight of suppository mold is in grams. Here we have discussed that it is in 2 grams. 2 grams of 2 gram weight for the suppository mold weight. Okay, so it is 0.06 grams drug per suppository. So then the total amount of the drug will be 0.36 grams. Then it will be 0.36 grams. Okay, next we have the base weight. What is the base weight? Base weight. So base weight, what we have to do? We have to assume. Okay, base weight, if it is not mentioned, nowhere it is mentioned about this much of base is the displacement value for base we have to find. Right? So this much of base is used, nowhere it is given. The base weight has to be taken from the mold capacity. Okay, the base weight, it has to be considered from the mold capacity. Okay, so the mold capacity is 2 grams, means for each suppository the base weight should also be 2 grams. The base weight will also be 2 grams for each suppository. Okay. So here they have not mentioned how much percentage of drug is used, and all these things were not mentioned. So we can directly go for the calculation. So the base weight of the suppositories here is 12 grams. Okay, this is theoretical weight. Theoretical weight of the suppositories. We are assuming that each suppository, because each suppository is of 2 gram weight, the base weight will be 2 grams. That's all. Okay. So then the actual weight is 12 grams. Actual weight is 12 grams. So actual weight, here you can also go with a simple calculation. Okay, even if you are not calculating all these things also, here you can go with a simple calculation. The actual weight is also 12 grams. Actual weight is also 12 grams. And the theoretical weight is also 12 grams. Okay, theoretical weight is also 12 grams and actual weight is also 12 grams. So then the displacement value should be 1. Okay, then the displacement value, it is a quick calculation. It's a kind of a tip. It's a kind of quick tip. If the theoretical weight and the actual weight are 1 and the same, then the displacement value of the suppository will be 1. Okay, it will be 1. It's a kind of like rough calculation type. Okay, but actually what we have to do? Yeah, we have to calculate the actual base that is used in the suppositories, that is 12. Okay, so how much base is used? Some 12 grams. From 12 grams we have to remove the quantity of drug. Quantity of drug, that is 0.3 grams. Then it will be 11.6 grams. Okay, 11.64 grams. Okay, so then the weight of the drug is 0.3 and the weight displaced, the displaced base will also be 0.3, same, will be 1. Just now as I told you, will be simply it will be 1. Okay, displacement value calculation, it is sometimes they give it as displacement value of phenobarbital sodium in 6 suppositories, each containing 40% of the drug. Okay, they will mention as in percentage. 40% of the drug, 25% of the drug. Then you have to calculate the percentage based on the total weight. Based on the total weight of the base. Okay, next question. The true statement about first order kinetics is the half-life increases with an increase in dose. Constant amount of a drug is eliminated in a unit time. The rate of elimination is constant and the rate of elimination is proportional to the plasma concentration. The true statement about first order kinetics. What is the true statement here? Yes, the rate is proportional to the concentration. Very important. The primary principle of first order reaction. Okay, the primary principle of first order reaction itself is the rate. Okay, rate is directly proportional to the initial concentration. The rate of a reaction is directly proportional to the initial concentration of the drug. This is the very principle of first order kinetics, right? Okay, and the remaining things. So the first order, the constant fraction is eliminated per unit time. So the rate is constant in first order reaction. No, the rate of reaction is not constant. The rate of reaction is constant in a zero order reaction, not in a first order reaction. In a zero order reaction, the rate of reaction is constant. Half-life changes with dose. No, half-life is independent. Half-life is independent of dose in first order. In first order reaction, the half-life is independent of dose, whereas rate is dependent on dose, and half-life is independent of dose. Okay. So here the right answer is the rate is proportional to the concentration. That is the true statement about first order kinetics. Okay, moving forward to the next question. Very important from, yes, we can expect one question definitely from IVIVC. From in vitro in vivo correlation. IVIVC is nothing but in vitro in vivo correlation. We can definitely expect a question. Okay. In which category of IVIVC is the mean in vitro dissolution time compared to the mean residence time? Okay. So which type of IVC or which category of IVC compares MDT to that of the MRT? MDT to that of the MRT. Mean dissolution time is compared to that of the mean residence time. What is the right answer here? What's the right answer? Level A, level B, level C, and level D. What is the right answer for this question? Right answer for this question? Yes, anyone? Quick, whoever are online. Yes, I need quick answers. It is level B correlation. Okay, it is level B correlation. Level B correlation, it is dependent on it. So, only level B analysis. Please remember, all through the IVIVC, all through in vitro in vivo correlation analysis, we have only one correlation, that is only type of B, level B correlation, which is dependent upon the statistical moment analysis. Which is dependent on the statistical moment analysis. Why we are discussing about statistical moment analysis here? Because mean residence time is a parameter which is obtained only in statistical moment analysis. Okay, only in statistical moment analysis. MRT, mean residence time, it is a parameter which is obtained, which can be studied or which can be obtained only by this particular theory, statistical moment analysis only, non-compartmental models. Okay, non-compartmental analysis. It is known as non-compartmental analysis or statistical moment theory. It is not a compartment analysis parameter. MRT, it is a non-compartmental parameter. Okay. So, it is the only thing which is obtained, which is studied under level B correlation. Okay, and level A correlation is the highest point correlation. Level A kind of IVIVC, it is the highest kind of correlation. It is usually a point-to-point correlation where usually we measure Cmax. Okay, Cmax to that of the maximum concentration to that of Cmax. Okay, we usually measure points and in vitro dissolution time to in vitro absorption time. It is dependent upon a series. It is dependent upon a series rather than single points. Okay, whereas C is a single point correlation where only one parameter is measured. Only one parameter is considered for measurement. Okay. And out of this IVIVC, the highest point of correlation, the correlation through which we get a highest range of correlation is level A correlation. Level A correlation. Next we have when two or more drug products, question from bioequivalence, question from equivalence. Okay. When two or more drug products contain the same therapeutically active ingredient, elicit identical pharmacological effects and can control the disease to the same extent, this is known as yes, what is it known as? Chemical equivalence, pharmaceutical equivalence, bioequivalence, and therapeutic equivalence. And therapeutic equivalence, what is the right answer? Yes. See, it is mentioned here clearly that it contains the same therapeutically active agent. It consists of the same therapeutically active agent, which is exhibiting a identical pharmacological effect and same extent of therapeutic effect. Okay, therapeutical active ingredient, that means the concentration and activity. The concentration of therapeutically active ingredient and the therapeutic activity of the active ingredient, both are one and the same, both are similar, then we can call it as therapeutic equivalence. Okay, so when it is chemical equivalence, means it consists of when two or more drug products, they consist of same quantity or same type of chemical entity or chemical moiety or the same concentration amount of chemical moiety. It is known as chemical equivalence. Pharmaceutical equivalence means same quantity of pharmaceutical ingredients. Okay, same pharmaceutical means formulation ingredients, excipients ratio. If it is similar, it is known as pharmaceutical equivalence. And what is bioequivalence? Bioequivalence, when two or more drug products, they exhibit a similar bioavailability. Okay, when two or more drug products they exhibit a similar bioavailability, it is known as bioequivalence. Okay, so that particular phenomena is known as bioequivalence. Okay, so when a reference product, when a new drug product, okay, when a generic drug product or when a new drug product, it exhibits more higher bioavailability than that of the existing product. If it exhibits higher bioavailability, if it is exhibiting equal bioavailability, then it is bioequivalence. Okay, if the new drug product, if it is exhibiting higher bioavailability than the existing product, then the term is used is the supra bioavailability. Okay, then the phenomena is known as supra bioavailability. Okay, that means higher bioavailability than the standard. Next, okay, so this is therapeutic equivalence, I just told you. Next, one more question from pharmacokinetics. One more problem-based question from pharmacokinetics. A patient receives, excuse me, just a moment. Okay. A patient receives a single IV dose of 300 mg, producing an immediate blood concentration of 8.2 mg per liter. Calculate its apparent volume of distribution. This is a direct question, in fact. Okay, direct question. Where? Okay, so what is the data that we have? The data is dose of the drug. The dose of the drug is 300 mg, and the concentration of drug, the plasma concentration of drug is 8.2 mg per liter. 8.2 mg per liter, and from this what we need to calculate? The apparent volume of distribution, that is nothing but Vd. Vd equals to x naught by c naught, as we know the formula. Vd equals to x by c, that is dose of the drug by the initial plasma concentration. X0 is nothing but 300 mg upon 8.2 and the right answer is yes, 36.6 liters. 36.6 liters. Okay. Yes. Fractional distillation method is used for the separation of azeotropic mixtures, solid mixtures, binary mixtures, and eutectic mixtures. Fractional distillation is used for the separation of which kind of mixtures? Binary mixtures, FP. I usually say this. Okay, Facebook. Okay, we have to remember it as Facebook, FP. So we usually use this term FP, right? So fractional distillation is used for the separation of binary mixtures. Very important question. We will definitely get one question from distillation. Most likely question from distillation is most likely. Okay, either from the applications or the construction. Especially we will get the volatile oils. Volatile oils are separated by steam distillation. Okay, binary mixtures are separated by fractional distillation. Okay, and also like this, in the same way, azeotropic distillation. Okay, vacuum distillation, also known as distillation under reduced pressure. Okay, vacuum distillation, also known as distillation under reduced pressure. It is suitable for heat sensitive compounds. Okay, and also like azeotropic distillation which is suitable for azeotropic mixtures. Azeotropic mixtures means the mixtures which have a similar boiling point. Okay, the mixture of components it is used for the separation of components of a mixture where the boiling points of the mixture are similar. Okay, especially ethanol water system. Very, very important, ethanol water system. It is separated. In an ethanol water system, ethanol and water are separated by means of azeotropic distillation. For maintaining perfect sink condition, the dissolution apparatus preferred is USP type 2, type 3, type 1 and type 4. What is the right answer to maintain perfect sink conditions? Yes, I need some responses. Please, why are you so silent, all of you? All of a sudden, why did you get silent? Actually, I am shouting, so I need to get silent. To be frank, but you people are tired. You people are more tired, right? For maintaining perfect sink condition, the dissolution apparatus preferred is type 2, type 3, 1 and 4. Which one is the right answer? Yes? Type 2. Okay, USP type 2 paddle. USP type 2 apparatus is paddle, which is very much suitable to maintain a perfect sync condition is maintained by means of USP type 2 apparatus, that is paddle, the most widely used for most of the dosage forms. Okay. Whereas in USP, how many types of dissolution apparatus does USP offer? Yes, USP, it classifies 7 types of dissolution apparatus. There are total 7 dissolution apparatus according to USP. Type 1 is basket, type 2 paddle, type 3 is the reciprocating cylinder, type 4 flow through cell, type 4 is flow through cell, and type 5 is paddle over disc. Okay, type 5 is paddle over disc, type 6 will be rotating cylinder, and type 7 is the reciprocating holder. Okay, reciprocating holder is type 7. Okay, totally there are 7 types of dissolution apparatus according to USP. Okay, Latin term used in prescription QOD. Okay, please don't get confused. Okay, wantedly I think I gave this question. Latin term in the prescription QOD suggests what? As needed, every hour, once a week, every other day. So what does this indicate? QOD means quaque altera die, means every other day, every alternate day. QOD means every alternate day. Okay, so usually QOD is confused with QID. Okay, QOD is usually confused with QID, whereas QID means quarter in time. Quarter in time means 4 times a day. 4 times a day. QOD means every alternate day. Every alternate day. Okay. So as needed means prorinata. Okay, prorinata. As necessary. So when necessary is SOS. As needed is PRN, and when necessary, C opposite. SOS is when necessary. Okay, every R is QH. Okay, so all these things we know, QID, BID, all these things we know very well. And next we have the consider the following statement. Highly crystalline polymers generally have a higher melting point than amorphous polymers. Yes, amorphous polymers do not exhibit a glass transition temperature. Yes, both statements are true, both statements are false. Statement 1 is true, 2 is false. 1 is false, 2 is true. What is the right answer in this? What is the right answer? Crystalline polymers have a higher melting point than amorphous polymers. Absolutely correct. Absolutely correct. Crystalline polymers, they have a higher melting point than amorphous polymers. Amorphous polymers do not exhibit a glass transition temperature. Blunder. Amorphous polymers have the characteristic feature of amorphous polymers is the presence of glass transition temperature. Is the presence of glass transition temperature. So the right answer is statement 1 is true, whereas statement 2 is false. Statement 2 is false. Okay, almost all the amorphous polymers, it is the glass transition temperature is the characteristic feature of every amorphous polymer. Where this amorphous polymer it converts, okay, it gets converted from a rigid state, okay, from a rigid state to a flexible state. Glass transition temperature is nothing but the amorphous polymers, the temperature at which the amorphous polymer changes from a glassy state to a soft state, to a rubbery state. Glassy state to a rubbery state is known as glass transition temperature. It is the characteristic feature of all the amorphous polymers. Okay. Next, match the parameter with its formula. Very important question. Once again, parameter with its formula. Bioavailable fraction. Okay, what is bioavailable fraction? Relative bioavailability, absolute bioavailability, and steady state concentration. Okay, so even in this type of questions, if you are confident of 1 or 2 options, then we can go with the option. Go with the elimination method. If you have any confusion, especially most of the times we have a confusion between relative bioavailability and absolute bioavailability. Okay, we will have a confusion between relative and absolute bioavailability. Then keep it aside for a while. Okay. So we will go with the bioavailable fraction. That is, bioavailable fraction is nothing but bioavailable dose by administered dose. 1B. Okay, 1B is there in 3 options. 1B is there in 3 options. Next, we have the steady state concentration is nothing but infusion rate by clearance. Okay. Okay, infusion rate by clearance. 4C, 1B, 4C, only two options. Yeah, again two options. 1B and 4C, two options. Right? 1B and 4C we have in two options. Then we will go. Then you go with the remaining. Okay, if you are stuck at this point, then you go with the remaining options. If that is clear, then we don't need to go. This is the elimination. This is the quick solving strategy. Okay, quick questions solving strategy. Go with the most identifiable one or two options, and then if it is necessary, check with the options. Okay, go with one or two parameters and check with the options. If you are coming to a conclusion with the option, then go with the option. That's all. Go with the answer. Okay, only you need to just cross check. That's all. Okay, next, relative bioavailability is yes, AUC of test with that of the standard and absolute is AUC of the drug with that of the oral with that of IV. Okay, so right answer is 1B, 2D, 3A and 4C. C is the right option. Okay, next. Preservatives with their category. Methyl paraben, benzalkonium chloride, chlorbutanol and benzyl alcohol. Methyl paraben, what type of substance is it? Benzalkonium chloride is a quaternary ammonium compound. Okay, so come to certain conclusions. You are not, yes, we are not sure of methyl paraben. Then benzalkonium chloride, it is a quaternary ammonium compound. Chlorbutanol, yes, what type of? And benzyl alcohol, whether it is an ester or alcohol, yes. Then yeah, methyl paraben, it is a ester. Methyl paraben is an ester. Okay, so here you have a benzyl alcohol is alcohol. Benzalkonium chloride is quaternary ammonium compound. B1, D2. B1, D2. Only one option. See, we have only one option with B1 and D2. Yes, go with that option. That's all. Okay. Go with directly. You go with that option. If you are not sure about methyl paraben, whether it is an ester or a halogen. Okay, if you are not sure, then directly go with this. You know, benzalkonium chloride is this, and benzyl alcohol is alcohol. That's all. B1 and D2. B1 and D2, we have only one option. Go with that option. That's all. Don't waste time. Without wasting time, yes, you can go. Okay. Methyl paraben is an ester actually. Methyl paraben is an ester. Yeah, benzalkonium chloride is a quaternary ammonium compound, which is most widely used as a preservative in semi-solid dosage forms, mostly in semi-solid injectables. Okay, injectable and parenteral type of dosage forms. In parenteral type of dosage forms and chlorbutanol, benzyl alcohol, etc. Yeah, strip packaging provides better moisture protection than blister packaging. In strip packaging, the product is completely enclosed in foil. Yes, of course. Strip packaging provides better moisture packaging than blister. Yes, of course, that is true. A is true. In strip package, the product is completely enclosed in a foil. Yes, this is the reason. A and R are true, and R explains A. Okay, A is the right answer here. Yes, it explains A. Because of that reason, they are suitable. Next, vanishing creams have a phase separation. Okay, vanishing cream contains stearic acid, potassium hydroxide, glycerin, and water. The primary reason for phase separation during storage at elevated temperatures. Elevated temperatures, what happens? Yes. Yes, because of the presence of stearic acid and potassium hydroxide, because there is no proper suspending agent. Okay, glycerin is a humectant here. Because of the absence of a proper suspending agent, what happens? Coalescence occurs. Coalescence occurs due to the decreased viscosity of continuous phase. Okay, if this vanishing cream, it contains a proper suspending agent, it will have a higher viscosity. So due to decreased viscosity, what happens? Coalescence occurs. Coalescence of the globules occurs, and it leads to phase separation, and it causes phase separation. Okay. Next, no chance of phospholipid repairing, no HLB change, no zeta potential changes. Okay, next. Okay, deviation from Raoult's law. Question from deviation from Raoult's law. Which deviation from Raoult's law is observed when adhesive forces are greater than cohesive forces? Adhesive forces are greater than cohesive forces. What is the right answer? Right answer? Yes, please. Please answer. Please answer. Yes. Can I have some answers, please? Some answers, whoever are online, please type in the chat box. 1, 2, 3. Okay, so very soon we are going to announce the result of today's test. Okay, immediately after this discussion, after this part, I'm going to announce the result of today's test. Are you not excited? Are you not excited? Yes, stay active. I will announce the result. I'm going to announce the result and toppers list. I'm going to announce the result of today's test very soon. Soon after this discussion. Okay, do not go away, all of you. Please stay back. It is a negative deviation. When adhesive forces dominate the cohesive forces, the deviation that is obtained is a negative deviation. It is a negative deviation is observed. And when cohesive forces are dominating adhesive forces, when cohesive forces dominate adhesive forces, it is positive deviation. Okay, the following drug is not included in the first schedule of DPCO. Question from pharmaceutical jurisprudence. Pharmaceutical jurisprudence. The following drug is not included in the first schedule of DPCO. DPCO is Drug Price Control Order 1995. Aspirin, rifampicin, vitamin A and paracetamol. Yes, vitamin A. Vitamin A is not a scheduled drug. Okay, vitamin A it is a unscheduled drug. Okay, all these three, aspirin, rifampicin and paracetamol, they are scheduled drugs. They belong to according to DPCO status, they belong to scheduled status, whereas vitamins, they belong to non-scheduled status. Okay, even after the amendment in 2013, still vitamin A is under non-scheduled status only. Okay, it is not included in the list, in the essential medicine list, not included in the first schedule. Okay, it is not included in schedule even. Match the given act and rules with their ears. Poisons Act, Drugs and Cosmetic Rules, Patent Act and Factory Act. Okay, so if we are not sure, most of us will not be sure about Patent Act and Factory Act. Okay, we are not that sure about these two. Okay, but we are sure about, the first thing we are sure about is Drugs and Cosmetic Rules. Drugs and Cosmetic Rules, it's not about act, it is about the rules. Rules is 1945. Drugs and Cosmetic Rules is 1945. Q less, yes, it is, Q is 4. Q4, only one option, we have only Q4 in only one option. And Poisons Act 1990. Poisons Act is a beginning, it is almost the first act that has been introduced. Okay, after the complete establishment of regulations, almost it is the first act that has been established, that is 1919 Poisons Act. Okay, so we are sure P1, Q4, that's all. Patent Act R2 1970, Patent Act and Factories Act in 1948. Okay, so answer is C. So please remember, please go for, whenever you want to come to a conclusion, filter the answers, filter the options, analyze, just check the question, check the options. If you are not sure, when you are sure, yes, absolutely, that is good. But when you are not sure with the right answer, then you have to go for elimination method. Prefer elimination method. Very, very important elimination method is. Okay. Read the following statements about schedules under Drugs and Cosmetics Act. C1 includes biological products, serums and vaccines. True. F3 includes standards of surgical dressings. Yes. M1 includes manufacture of homeopathic drugs. FT includes the manufacture of medical devices. No. Schedule T is not right here. P, Q, R are true and S is false. Schedule T is not about the manufacture of medical devices. The Schedule T is about the GMP of, it is about the Ayurvedic ASU drugs, Ayurveda, Siddha, Unani drugs. It is about the GMP status of Ayurveda, Siddha, Unani drugs. Schedule T. Okay, all the remaining are true, yes. Identify the incorrect statement about members of Drug Technical Advisory Board. Drug Technical Advisory Board. Okay, incorrect statement. Please remember. See, you have to identify these questions incorrect, whether they are acting, whether they are this, the marker statements. Incorrect, except. Okay, many times we will get questions like this. Incorrect, except. These are the what we have to say. These are the bullet words. We have to identify these words. Okay. Incorrect statement about the members of Drug Technical Advisory Board. Option B. Okay. Yes, the drug controller of India, he is not the chairman of DTAB. Who is the chairman of DTAB? Director General of Chairman. Okay, Chairman of the Director General of Health Services. Director General of Health Services is the chairman of this DTAB. Okay, DTAB is nothing but Drug Technical Advisory Board. Okay, and according to Pharmacy Act 1948, the minimum educational qualification required for registration as a pharmacist is prescribed by the Pharmacy Council of India, because Pharmacy Council of India itself it regulates the main principle and the main motive. The very motive of Pharmacy Council of India is to regulate pharmacy education in India. Okay, it deals with it does not deal with import, it does not deal with the export, it does not deal with the narcotics, it does not deal with anything. It deals with the education and pharmacy regulation and pharmacy education in India is Pharmacy Council of India. Okay. Under Drugs and Cosmetics Act, this schedule prescribes the requirements for the functioning of minimum standards of blood bank. Okay, blood bank, F for blood bank, FB again. FB again, we have FB again here. F for blood bank. Okay, F for blood bank and its related products. Okay. So schedule F for the blood bank requirements. M for, yes, we all know GMP. M deals with the GMP, and schedule N for the list of equipment for running a pharmacy. Is most important for pharmacy like pharmacists. Okay, schedule N is the most important schedule for pharmacists for list of equipment for running a pharmacy, running a retail pharmacy mostly. Okay, running a retail pharmacy mostly. And schedule Y, it deals with that of the clinical trials and import of new drugs. Clinical trials. Latestly, this schedule Y is revised as Clinical Trials Act. Okay, separately it is studied under Clinical Trials Act or Clinical Trials Rules. Separate it is studied is the schedule Y is slightly reduced, and clinical trials are studied separately in recent regulations. Okay, and yeah, question from biostatistics. We have a question from biostatistics and research methodology. Yes, we will have some questions from biostats also. Okay, in 2025 paper there were 2 questions from biostats. Okay, in 25 GPAT question paper there were 2 questions from biostats and research methodology. The question is students t-test application. Students t-test is used when? It is used when the sample size is greater than 100, population standard deviation is unknown, sample size is small and standard deviation is unknown, and data is categorized, and the data is categorical data. Okay, so what's the right answer? When the sample size is small and the standard deviation of the sample is unknown, then we go for student t-test. Okay, student t-test is mostly applicable when the sample size is small and the standard deviation of this particular sample is unknown. Okay, so usually for these tests, okay, the most commonly used test other than t-test, the most commonly used test is the F-test. Okay, the most widely used one is the F-test and P-test. Okay, F-test and P-test. Okay, and if there is a large sample, if the sample is large and we know the standard deviation, yes, we have to go for Z-test. Okay, and if it is categorical data, here we are studying about the categorical data. See, C for C, categorical data, we have to go for the chi-square test. Okay, for categorical data, we have to go for the chi-square test. Okay, next. And interpreting of R equals to minus 0.9. R equals to minus 0.9. What does that indicate? What is R here? Okay, what is R here? R is the correlation, rank correlation. Okay, correlation coefficient. R is nothing but the rank correlation coefficient. This is related to Pearson's rank correlation. Okay, this concept is related to Pearson's rank correlation. Pearson's rank correlation coefficient. Okay, R is it is the rank correlation coefficient. R is the correlation coefficient. Okay, if it is minus 0.9, if the R value is minus 0.9, what does it indicate? It is a weak positive correlation or strong positive correlation. Yes, both of these we can eliminate. Okay, both of these we can eliminate because it is positive. It is not a positive correlation. The value is negative. The value is negative, so it is a negative correlation, of course, right? Okay, so now we have to conclude whether it is a weak correlation or a strong negative correlation. Weak negative correlation or a strong negative correlation? Yes, it is a strong negative correlation because please remember whether it is positive correlation or a negative correlation, whether it is a positive correlation or a negative correlation, any value above 0.7, okay, any value above 0.7 will be strong. Okay, 0.7 is the standard for this correlation coefficient. Usually 0.7 will be standard. Okay, anything above 0.7, any correlation coefficient above 0.7 will be a strong correlation. Okay, if it is something around, if we have something around 0.4, so then it is a weak negative correlation. Okay, so this is about the Pearson's rank correlation. Okay, guide. Okay, according to Pearson's correlation guide, yes, usually the correlation coefficient values ranges from -1 to +1. It ranges from -1 to +1. So if the magnitude, if it is greater than 0.7, it indicates strong correlation. Okay, this we will move a little faster. ABC analysis. Questions from pharmaceutical management. Okay, we usually get questions from pharmaceutical. The miscellaneous questions. Miscellaneous questions. There is the probability of ABC analysis. This is the most widely used analysis in any kind of management, in pharmaceutical management including. Okay, ABC analysis. What in ABC analysis? A category. Okay, the items that belong to A category items are characterized by low cost and high quantity, high cost and low quantity, moderate cost and moderate quantity, low consumption value. What is A category indicates here? Okay, A category it indicates high cost. Okay, A category means it indicates the items with high cost and low quantity. Yes, A refers to high cost and low quantity. Okay, B items are moderate value, moderate cost and moderate quantity. Which are available in moderate cost and moderate quantity. They come under category of B. Okay, A, B, C analysis, and C are those which have control. Okay, which has least value, maximum control. Least value and minimal control. Least value and minimally controlled products. So usually in ABC analysis in marketing, please remember in marketing, in pharmaceutical marketing or any kind of marketing, ABC means C has a larger magnitude than A. A will always be of less magnitude. Okay, A will always be less, magnitude is less and it will be powerful. A is powerful with less magnitude, with less space. Okay, lesser space. We have to identify the graph space here. In pharmaceutical management, when we are going for these triads, okay, we have to identify the graph space. In graph space, what happens? It has a less space, less magnitude with higher power. Okay, we have to remember this. Okay, in order to make a generic substitution, a pharmacist must notify the patient of the substitution. That means if any, for any innovator's drug or for any written drug, if the pharmacist is substituting a generic product, okay, if he is not giving the same product, if he is substituting with another generic product, what he has to do? Okay, what he has to do? It is a hospital pharmacy. Okay, question from hospital pharmacy. Notify the patient of the substitution, change the same or lower price, charge the same or lower price, place the brand name on the label. No, not really. Obtain physician's consent. No, he has to inform the patient of the substitution. For each substitution, the pharmacist, so that is the basic duty of the pharmacist. Pharmacist can directly substitute. He has every right to substitute. That is the duty and function of a pharmacist. That is the right of a pharmacist actually. Okay, so, but he has to inform the patient that he is substituting. That see this particular, as I'm running short of this particular drug, I'm replacing this with the same drug with the same formula. I'm replacing with another generic product of the same formula. Okay, The formula, everything will be same. Then he has to at least explain. Okay, so it is not possible. It is not absolutely possible in India, but this is actually the procedure that has to be taken place. Okay. A question from pharmacovigilance. Okay, a question from pharmacovigilance actually. ADE reporting, adverse drug event reporting is the responsibility of the following except pharmacist and a physician, manufacturer, consumer and regulatory authorities. Yes, all of the following except, please remember it is except a regulatory authority. All the remaining healthcare professionals like pharmacists, physicians, manufacturers, everyone, consumers, even every one of them, they have the responsibility. Manufacturer also, they have a responsibility. Manufacturer also has the responsibility to report AD, to report the adverse event. Okay. So all of this should be done except regulatory authority. Regulatory authority is the authority who has to take the complaint. Okay. Or who have to work on it. They should not go with the complaint. They should not report. They should handle the report. Regulatory authorities will handle the report or solve the report. Okay, next. TGA. The Therapeutic Goods Administration is the regulatory authority of. Okay, question from Regulatory Affairs. Okay, question from Regulatory Authorities and Regulatory Affairs. TGA, Therapeutic Goods Administration, is the regulatory authority of Europe, Australia, Canada, United Kingdom. Yes, it is the regulatory authority of Australia. Yes, very good. For Europe, the regulatory authority will be EMA, European Medical Agency or European Medicine Agency, EMA. Okay, and Canada, it is TPD, Therapeutic Product Directorate. Okay, Therapeutic Product Directorate, and US and in UK it is MHRA, Medicine and Healthcare Product Regulatory Agency, MHRA. Okay, usually the students, most of them who aspire to go to UK. Okay, the students who aspire to go to UK, they need to write a examination which is conducted by this MHRA. Okay, which is conducted by this MHRA. They need to qualify this examination. They need to clear this examination which is conducted by MHRA, that is Medicine and Healthcare Product Regulatory Agency. For India it is in India, the regulatory agency or regulatory authority is India. Yes, it is CDS. India, it is CDSO. Okay. Central Drug Standard Control Organization. Okay, Central Drug Standard Control Organization, CDS. Next, we have the key concept of total quality. Question from Total Quality Management. The key concept of total quality management is commitment of all the employees. See, I'm moving a little faster. Okay. Yeah, and we have a question from Human Anatomy and Physiology. Yes. Most probably 1 or 2 questions from Human Anatomy Physiology are expected. These are usually, it comes under pharmacology part usually. Okay, 1 or 2 questions from Human Anatomy Physiology are expected. Just go through the important concepts of Human Anatomy and Physiology. The cardiac impulse conduction. The correct sequence of initiation and conduction of cardiac impulses is. Correct sequence of initiation and conduction of cardiac impulses is so and so, so and so, so and so. Yes, where does the cardiac initiation and conduction, where does the cardiac impulse start? Yes, the right answer D, it starts at the SA node. That's why SA node is known as the pacemaker of the heart. Okay, this is the reason SA node is known as the pacemaker of the heart. Pacemaker of the heart. Because of this reason, this is known as the pacemaker of the heart. Because the impulse conduction starts at SA node, and then it goes to AV node. Okay, then it goes to AV node. Okay, when it starts at the SA node, the impulse is very fast. Okay, when it starts at the SA node, the impulse conduction is very fast impulse conduction, and it starts with the atrial contraction. It proceeds at the faster rate and reaches AV node, slows down a little. Okay, it slows down a little, and from here it reaches the bundle of His, and from bundle of His it reaches the Purkinje fibers. By the time this impulse reaches the Purkinje fibers, it gets neutralized. Okay, it gets almost neutralized. Then it means it slows down. It slows down. The cardiac impulse slows down. Otherwise, what happens if it does not slow down? If it does not slow down, what happens? It results in arrhythmia. It results in these kind of disorders. If the cardiac impulse is in the same way, if the same, it starts with that. So that is what sometimes they say. There is a problem with the pacemaker. They have replaced the pacemaker, or there is a problem with the pacemaker. What happens if there is a problem with the pacemakers? Okay, so they will give stent. Okay, stent is nothing but the artificial pacemakers. Stents, what they do? Cardiac stents and all they give. So what are they? They are the artificial pacemakers. When there is some contraction issues with the pacemakers, what happens? There will be a contractility issues, and then yes, we will go for yeah, definitely, sure. Okay, so this is about the pacemakers. Okay, artificial pacemakers, that is stents. Usually stents and artificial pacemakers are used in case of damage to this particular pacemaker. Okay, unpaired cartilage of larynx among the following. Unpaired cartilage of larynx. Okay, in larynx there are cartilages. So why we are thinking cartilage is something which is related to bone? No, muscular system, not at all. Okay, there are cartilages in larynx also. In larynx, there are very important question, very important question. Unpaired cartilage of larynx among the following. So one of the most prominent questions in Hyper JEE. Okay, one of the most widely asked questions in Hyper JEE. In Hyper JEE, you will get more questions from human anatomy physiology. Okay, these unpaired cartilages: arytenoid cartilage, corniculate, cricoid, and cuneiform cartilage. What is the right answer? Cricoid cartilage is the right answer. Okay. So in larynx, totally there are 9 cartilages. Okay, in a larynx there are totally 9 cartilages. Out of this, there are 3 are unpaired and 3 are paired. Okay, 3 are unpaired, 3 are paired means 3 plus 3 into 2. Paired means 3 into 2, right? So 6 plus 3, total will be 9. So the total will be 9. Okay, totally there are 9 cartilages in larynx. Out of these, the unpaired ones are, that means single cartilages are thyroid, cricoid, and epiglottis. Epiglottis we have. Okay, we have epiglottis, right? Epiglottis, cricoid cartilage, and the thyroid cartilage. Cricoid cartilage is present in the form of a circle. Okay, circular cartilage of larynx is. Sometimes question will also occur like this. The circular cartilage of larynx is cricoid cartilage. Remember, C for circle. Cricoid cartilage is circular in manner. Okay, cricoid cartilage and thyroid cartilage, whereas paired cartilages are arytenoid cartilage, corniculate cartilage, and cuneiform cartilage are voice modulation. Okay, larynx is voice box. Okay, larynx is nothing but voice box, right? So the voice modulation is a function of this arytenoid cartilage. This is also important. Many competitive examination point of view, the voice modulation which is accomplished by larynx is by means of voice modulation in the larynx is accomplished by means of arytenoid cartilage. Okay, next we have questions from pharmacognosy. I will just give the answers. I'll just give the key, that's all. Okay, from pharmacognosy. We'll not going, because these are all very simple questions. Okay, and pharmacognosy, please remember pharmacognosy is one of the most prominent parts. If you are thorough with pharmacognosy, the classification of glycosides, alkaloids, tannins, resins, volatile oils, and marine drugs, whatever, the important topics of pharmacognosy, classification of pharmacognosy, the biological source, the basics, the schematic study of pharmacognosy, yes, you can definitely clear the examination. Because pharmacognosy, it is it's not like something you need to analyze. Only you need to remember. That's all. Okay, you need to study, remember. Study, revise, remember. That's all. Like SAR, you have to follow SRR. Study, revise, remember. That's all. You don't need to analyze here. No SAR. No analysis. In pharmacognosy, there is no analysis. Okay. Only revise, remember. That's all. Okay. So thaloquine, question from thaloquine test. Powdered cinchona gives emerald green color with bromine water and dilute ammonia solution. This test is known as the thaloquine test. Okay, cinchona, we all know cinchona, it consists of quinine alkaloids. Cinchona belongs to a class of alkaloid drugs. Okay, Cinchona belongs to the class of quinine alkaloids. Okay, the alkaloids that are obtained from Cinchona are alkaloids obtained from Cinchona are quinine, quinidine. Okay. Yes. So it gives the thalioquine test. So here what they have given, they have not. The one of the following test is characteristic for Cinchona alkaloids. No, not a slightly indirect question. Okay, I have given this question. Okay, only for this reason, because like you need to, like you just need to know this also. Okay, this is also very important. You will get questions like this. You will get most high probability of questions like this. Thalioquine test. Next, Shankh-Pushpi. Identify which of the following statements about Shankh-Pushpi is incorrect. It is obtained from the aerial parts of Campscora decussata. Its alcoholic extract possesses antiviral activity against Ranicate virus disease. This is virus that contains alkaloids known as Shankh-Pushpin and convolvulin. Yes, right. Also known as aloe weed. It is also known as aloe weed. Shankh-Pushpi, also known as aloe weed. Yes, they all are right actually. This biological source, the name of biological source is wrong. Shankh-Pushpi is convolvulus. It is not Campscora, it is convolvulus. Okay, so please remember Shankh-Pushpi. Shankh-Pushpi. See the flower, you see the flower. It is convoluted. It is in the form of, you see, distal convoluted and proximal convoluted tubule. We know the tubules, right? It is present in a convoluted form. Okay, it is present in a convoluted form. The shape itself is convoluted. You can see here. It is present in a convoluted form. Shankh-Pushpi. Okay, so the name is Convolvulus pluricularis. Convolvulus pluricularis. Okay, you have to see most of the drug names, they are somewhere related to their physiological, morphological, or any kind of characteristics. Okay, any kind of characteristics. Okay, so please try to correlate. Okay, this is a trick. This is a tip I'm telling you. This is like slight tips you need for this. Just go with remember with some morphological character, remember with some physiological character, or like this. Okay. Next, in the picrolinic acid test, which of the following gives a yellow color precipitate with picrolinic acid? Which of the following gives a yellow color precipitate with picrolinic acid? Resins or alkaloids or glycosides or tannins? What's the right answer? It is alkaloids. Okay, alkaloids exhibit a picrolinic acid test. Okay, they give a yellow color precipitate. Okay, picric acid test. Okay, what is it known as? What is it known as? Picric acid, or it is similar. It is similar to that of Hager's reagent. Hager's reagent is picric acid. This is picrolinic acid, which is exhibited by alkaloids. Okay, Hager's reagent, we know, right? Very the most widely we use. Hager's reagent, picric acid. Okay, it also gives yellow color. Next, the marine sources of drugs and their combination: cardiovascular substances, antimicrobial compounds, marine toxins and cytotoxic compounds, antoflurins, brevitoxins, oxytocin, and cycloiodesmol. And the right answer is antoflurins. Okay, cardiovascular substances are antoflurins and marine toxins are saxitoxin. Okay, these are the correct combinations. These are the correct combinations. Cardiovascular substances are antoflurins and marine toxins are saxitoxin. Okay, whereas brevitoxin, it is a marine toxin. It is not an antimicrobial. Okay, here it is given as antimicrobial, but it is not an antimicrobial. Brevitoxin is a toxin, marine toxin. And cycloiodesmol, it has an antimicrobial activity. It is not cytotoxic. Here it is given as cytotoxic, but cycloiodesmol, it possesses antimicrobial activity. Okay, next question from prebiotics. Prebiotics, not probiotics. Prebiotics. Okay, nutraceuticals which promote the flourishing of probiotics. At present, the best known prebiotic is inulin. And prebiotics include bifidobacterium and lactobacillus species are such as, okay, see, that's what such statements confuses. These type of statements confuses. Prebiotics, not probiotics. Okay, so prebiotic, that means this bifidobacterium and lactobacilli, these are probiotics. These are probiotics. They are not prebiotics. Okay, prebiotics are non-digestible foods. Okay, these are non-digestible foods which are required for the growth of beneficial bacteria. Okay, probiotics are beneficial bacteria themselves. Probiotic bacteria means prebiotics are required for probiotics. Okay, they are not probiotics. They are required for the proper growth of probiotics. Next question. Smilagenin, epismilagenin and isomer yamogenin are present in which of the following? Thibautia, Safed Musli, Diascorea, Shatavari. What's the right answer? Right answer is Safed Musli. Okay, they are present in Safed Musli. In Thibautia consists of thibautin and Diascorea consists of diosgenin. We all know so very well. Diascorea consists of diosgenin and Shatavari it consists of saponins. Next, stomata and trichomes and their combination. Very, very important question. These type of questions are mandatory questions in your examination. This type of question are mandatory questions in your examination, in your final examination. Definitely you will get one kind of question like this. Okay. Diacytic stomata, sessile trichome, parasitic stomata, unicellular trichome, anomocytic stomata and multicellular trichome, anisocytic stomata and multicellular covering trichome and the respective plant drugs. Yes, respective plant drugs. Datura. Okay, Datura with diacytic stomata. TD. Okay, Datura with diacytic stomata and sessile glandular trichomes. Vasaka with parasitic stomata and Senna. We all know very well about Senna, right? Anomocytic stomata. Senna has anomocytic stomata and digitalis has anisostatic stomata. Okay, very important. Stomata, type of trichomes, type of stomata, and type of crystals, calcium oxalate crystals, stomata, calcium oxalate crystals, and trichomes. Very important. Very important. Next. And Ayurvedic formulations with their respective process. Bhasma, Arishta, Churna, and Lehya. Okay, Bhasma is calcination, Arishta. Yes. Alcohol generation, Churna, it is a dry powder, whereas Lehya is a semi-solid. Yes. Bhasma, it is obtained by calcination technique. Arishta, it includes alcohol generation. Self-generated alcohol preparation. Arishta, self-generated alcoholic preparation, whereas Churna is a dry powder. We all know very well Churna means dry powder and Lehya is a semi-solid kind of preparation. Very important again. Okay, next, analytical parameters and their respective acid value. Yes, acid value determines the free fatty acid content. Iodine value determines unsaturation. Saponification value will determine the molecular weight, and ester value will give the ester content. Okay, I'm sorry I'm going a little faster because we are running very we are doing this from a longer time. Okay, I think it is so late too. Alkaloids and their precursors, amino acids, tropane, indole, isoquinone, pyridine. Yes, sir. What is it? Yeah, tropane, ornithine. Okay, tropine for ornithine, indole, tryptophan. Okay, indole, you have to remember indole alkaloids, they have a tryptophan precursor. Indole, trypto. Okay, isoquinone, tyrosine, and pyridine, aspartic acid. These are also one question from the precursors of the amino acids. Precursor amino acids is for alkaloids. The one question from their synthesis, precursor amino acids, is also guaranteed. Definite question. Okay. So we have completed, reached the end of document, and hope you all gathered something, some insights, some knowledge. Yes, I need some responses at least at this point. I need some responses. Okay, so hope you found it useful. It was lengthy, of course, I understand, but it is required at this point of time. Hope we covered. Even so, how did you feel about the question paper and all? Any feedbacks? Yes. How was the question paper, like covering all the aspects and covering various subjects? Your feedback, anyone can type your feedback in the chat box. And you have any questions? Yes, some of you asked about how to prepare in the last minute preparations. Yes, sir. Please go with the consistent. Don't go with the new topics at this moment. Don't go with the new topics. Only go in a consistent manner. Only revise. That's all. Revise and answer. Go with the test attempts. At this place, you need to go with the attempt of test. Okay, only attempt more number of questions. Even if you have not studied, just go with the question attempt so that you will know the answer. Okay, that gives you some answer. You will know the answer. So if you are solving 100 questions and if you solve 100 questions and if you answer like if you attend paper discussions like this, you will know 400 questions with 400 answers. Okay, because we are explaining all the four options here. So you will know 400 questions. Okay, so 200 plus marks in mock test. Okay, yeah, that is a good score in fact. 200 plus is a good score. 200 plus in mock test is a good score. Yes. You can slightly improve with these 5 days if you are focusing more on revision, especially pharmacology. Okay, especially concentrate on pharmacology, classification, mechanism of action, adverse effects. That's all. Don't study anything. Don't study any nonsense pharmacology. Only go with the classification, mechanism, and adverse effects. Okay, you will get at least some 2 to 3 questions from the adverse effects. Be thorough with the adverse effects. Okay, make table of adverse effects, or you will get, okay, even if you are browsing also, you will get questions from, you will get some prominent drugs and their adverse effects. You will get at least 2 questions from the adverse effects, at least 2 questions. Okay, so in that way you have to prepare. Go with the prescribed, like specific, be specific with your preparation. Don't study all the nonsense. You don't keep all the books before you and study. No, that does not really work at this time. And also practice time management. Try to attempt more number of tests. Try to attempt more number of tests so that you will get time management. Try to attempt at least 1 or 2 tests per day. Don't study, only attempt tests, 1 or 2 tests per day. That's all. And if there is any discussion, go with the discussion. That's all. Don't study. Don't go with extensive studies. So then you identify where you are lagging. Okay. So you are getting so much of score, and continuously identify the consistency where you are making mistakes. Identify the consistency of your mistakes than where you are going, right? Identify the consistency of your mistakes. So in that, so identify that particular regions, and if you want to go through a quick points of that particular topics. That's all. If you want to study something, go through quick points of that respective topics. That's all. Don't study anything right now. Okay, only revise and attempt. Revise and answer the test. That's all. Only that parts you need to do. And yeah, do I have any questions? Any questions regarding this examination? Yeah, and the scores of the examination. I'll release the score. I'll release the winner toppers list of the score of this test. Okay, I'll do it online. In fact, okay, let me do it online. Okay, I'll give the list of toppers for today. Okay, yeah, hearty congratulations to all those who the top 10 scorers. Only see here, I'm displaying only the list of top 10 scorers of today's test. Okay, we have the topper Akshaya Reddy. Okay, the topper of today's test is Akshaya Reddy. Akshaya scored 309. Okay, her score is 309. I'm not going to detail all the other scores. Okay, I'll post all the scores. We will try to post all the scores in our app. Okay, I'll upload all the scores in this, whatever the respective folder, whatever we have given for attempting the test. In the same folder, I will upload the scores and your respective positions. Okay, you can, please don't don't panic, or please don't feel like, no, I'm somewhere or something like that. No, that is not the right way. Okay, so you still have time. Okay, hearty congratulations, Akshaya. And following the top 10 scorers are Sarthak. Congratulations, Sarthak. I think I have Sarthak online. The second scorer, my top second scorer is Sarthak of today's test. Okay, Sara and Varsha. So in a serial manner, Varsha, Pediredi Varsha, Dulam Himavarshini, Sahasra, Shujan Kumar Vempati, Machi Srinivas Reddy, V. Vandana, Sripati Meghana, Kaula, and Lahari. Okay, congratulations all of you on your successful scores on scoring top 10 in today's All India GPAT mock test. Okay, so they were all the scores were very near. In fact, okay, there is only much difference between the top 1 and 2 and 2 and 3. There is a vast difference. Otherwise, the difference is not much. Okay. But all of you, most all of them have scored 200 plus, above 200. It's very good, very good. That was a good score in the mock test. Good scores in mock. 200 plus is a good score in the mock test. Okay. So all the remaining scores we will upload in the app at the earliest by today evening, and also by this evening, or by today evening or by tomorrow morning. You can all download your review PDF. Okay, you can all download your respective answer PDF, the PDF of your answer sheet, your respective answer sheet, as it will be given by the NBEMS after the completion of exam. You will get a key, okay, with your respective answers, right? In the same way, by today evening or tomorrow morning, you can all download. You have a auto download option. You can download the PDF and you can check your consecutive answers with that of the right answer. You can download the PDF of this, and you will get your respective scores, analytics, and answers, and the solutions even. Okay, and do I have any questions? Any questions? Do we have any questions? So how did you feel about this test and paper discussion? Yeah, other than Dinesh Pharma students, is whoever is attending here, everyone is a Dinesh Pharma student for us. Of course, everyone is our student. Yes. Any suggestions or any feedback are welcome at this point. Yes, we welcome any feedback or suggestions in the chat box, please. Okay. Yes, thank you, and hope you are all. Yeah, some message it was retracted. Okay, no issues. So thank you all very much for joining this session, and keep revising and attempting. Just now, as I have told you, keep revising, attempting. Don't lose confidence. Most important thing in the examination, the most important tip you have to follow in the examination is don't panic, don't lose confidence. Okay, don't lose confidence. If you are not able to answer soon after you start your examination, if you are not able to answer if you are unable to answer some of the questions, don't panic. Okay, don't panic immediately. Yes, you go through the next sessions. Okay, stay calm, keep your mind cool, keep your mind focused. Okay, cool and focused. Okay, you think if you are not able to answer that particular question, okay, if I am unable to answer, I have prepared so well. Be confident of yourself. I have prepared so well. If I am unable to answer this question, no one will be able to answer this question. You think in that you think in that manner and you answer in that manner. So that will give you confidence, and that will give you a boost to answer the further questions. The further questions will not be impacted. Otherwise, if you are stressed, the further sections and whatever you know will also be impacted. Okay, please keep this in mind. Please remember, and we wish from
From Dr. Dinesh Pharma team, from the DDP team, we wish all of you all the very, very best for your examination, and we will get back immediately after the examination on a question paper analysis. Okay, we will join again very soon for a question paper analysis. Till then, have a great time. Wish you all the very, very best. Thank you all very much for joining the session. Have a great time, and we are signing off here. Thank you.